It being a little past 6 p.m., I'll go ahead and call the Winnebago County Board of Supervisors to order for October 20th, 2020. The county clerk has verified the roll and all members are present except Supervisors Wingren and Supervisor Warnke, who are excused, and Supervisor Gabbard will be here shortly, just running a little bit late. So the first items on our agenda this evening are the Pledge of Allegiance, followed by the invocation by Supervisor Locke. If you could please all stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now the invocation by Supervisor Locke. Please go ahead, Supervisor Locke.
We ask for your presence to be with us as we meet tonight. Inspire our thoughts, discussions, and ideas as we seek to work together. Amen.
Thank you, Supervisor Locke. Next item on the agenda is a motion to adopt this evening's agenda. And for that, I will call on Supervisor Albrecht.
I'll move
Please.
to adopt this evening's agenda.
There's a motion to adopt this evening's agenda. Is there a second? Is there a second? There is a second. We'll do a voice vote. All those in favor say aye.
Aye.
Any opposed? Motion carries. Moving on down to the next item on the agenda, and that's the time in this evening's agenda in which we allow an opportunity for anyone from the public to speak on any item on this evening's agenda or any item under county jurisdiction. Before we start, I want to mention two things. I want to mention one thing that I'll be doing this evening in regards to one of the ordinances on the agenda, so all are aware in advance. And then I also want to announce some ground rules for public comments. So first, I want to make everyone aware that when it comes up to the resolution that most people are here tonight to speak about in regards to the amendment to 11.08 ordinance, I will be offering up an additional amendment to it for the definition of a general order to add the verbiage, any general health order under this ordinance must not include a general workplace shutdown. So I'm making you aware of that because over the weeks and months, that is an issue that's been brought up by a number of individuals over time, and a number of individuals have heard that, and I myself included. So I do intend to make that amendment later this evening once we actually consider that ordinance later in the agenda. So I wanted to make all aware of that now. And then I also wanted to make everyone aware of the ground rules for the open forum public comments this evening. So first of all, for the public comments period, all public comments should come from a Winnebago County resident. And each individual, when called upon in its succession, will be asked to state their name and address for the record. Also would ask, given the number of individuals who have an interest to speak, I'm asking that all speakers try to hold their comments to 2 minutes or less. The goal with that is to try to have as many individuals an opportunity to speak this evening. Similarly, I would ask that each individual, once spoken, that would be their opportunity, and we would not have the same individual speak twice. And then the only other final ground rule for the public comments open forum is I am going to try to keep the public comments to a 2-hour maximum. So I'm letting you know that in advance because as we work through the public comments, I'm going to do my best to maintain that 2-minute maximum limit to try to allow as many individuals to speak this evening as possible. So I wanted to make everyone aware of those ground rules and that approach right from the get-go. So with that, we will go ahead and open up public comments in the open forum. What I'd ask for anyone from the public who wishes to speak, they can go ahead and raise their Zoom hand. What that does on my screen is I see a blue raised hand then on the right-hand side, and then I know who has requested first, and then I can go on down the line in succession. And all I'd ask is once I call on you is that you state your name and address for the record, and then please hold your comments to 2 minutes or less. And with that, I will go ahead and open it up. So I see a number of hands already raised. So first I will call on Jen Norden.
Hi,
Please.
can you hear me?
Yes, yes, we
Hi.
can hear you. If you could state
My
your
name
name and
is
address for the record, please.
Jennifer Norden, and I live at 4610 Island View Drive in Oshkosh.
Thank you.
And I've been a physician here in Oshkosh for more than 20 years, and I've been working on the front line of COVID-19 since this started. In mid-March, I had a vacation planned to Colorado, which I had to cancel. And instead I worked in the respiratory clinic seeing patients who had any respiratory illness. And ever since then, I've been working in the respiratory clinic and in my primary care clinic, trying to keep people as healthy as possible. I've diagnosed many people with COVID-19. And in the respiratory clinic, we sit in a very small room with these people, and they are often coughing, but they are wearing a mask and I wear a mask, and I have not caught it yet. And that's because masks work. The science says masks work. Everyone I know in healthcare has been working extra hard to provide care for the people in our community. Theta Care, Ascension, Aurora, and our county public health department have been doing all we can. And I'm really proud to be a part of that workforce. I am not proud to be from Oshkosh right now. COVID-19 is at wildfire status in our community. Hospitals are full, staffing is short, numbers are skyrocketing, and people are dying. It's up to 43 people in Winnebago County so far. And this could have been prevented if people had just listened to the experts. Simple measures like wearing a mask, avoiding large gatherings, and physical distancing. Yet we have community leaders like Michael Schra and John Casper who have fanned the flames of COVID-19 by mobilizing people to oppose a mask mandate and to not have any restrictions on their behavior. This wildfire of COVID-19 will continue to rage through our community until spring unless people start doing what it takes: wearing masks, physical distancing, and avoiding large indoor gatherings. And until this virus is under control, our economy is not going to recover. So this past weekend in Oshkosh, there was a large indoor wedding. 200 people were invited. Large indoor gatherings like this without masks are as dangerous as drunk driving or speeding through a school zone. We enforce
If I could
those
please
laws.
ask you to work to conclude your remarks. I'm going to try to hold to the 2 minutes.
Those of us in the medical field have done what we can do, and we will continue to do so, but it's time for business leaders, elected officials, and individuals to do their part. Let's fight the virus. Let's not fight each other.
Thank you, and thank you for your comments. Next speaker is Marlena R. If you could please state your name and address for the record, please. Please go ahead. Marlena R., if you could please state your name and address for the record, please. We'll go ahead and move on to the next individual. The next individual on the list is Jennifer Kozer. If you could please state your name and address for the record, please.
Can you hear me?
Yes, we can hear you. Thank you.
Jennifer Kozer, 5872 Harbor South Drive, Winnebago 54986.
Thank you.
How many times and how many different ways do the citizens of Winnebago County need to tell you that we do not want any version of 1108 passed? Hundreds, possibly thousands of people have contacted you and told you they are against this. Yet here we are again. Your job is to listen to the people and then represent the people. You work for us. The second you no longer think that you need to listen to us, you have no business sitting on this board. We are telling you what is best for us. Are you going to listen? If you vote in favor of 1108, you are sending a message to the citizens that you know better than we do what is best for us, and that you care only for your own agenda. Prove to us that you are listening and that you do represent us by voting against 1108. I would also like to say that I am opposed to agenda item 097, the resolution to give one-time bonuses to Winnebago County regular employees. In my opinion, when so many in the county are suffering from having lost their jobs or had their hours cut or lost their businesses, it's inappropriate for the county to give their employees bonuses. So I ask that you vote against both amendment 1108 and resolution 097. I'm finished, but my mother is next to me and she would like to speak as well and take her 2 minutes. Thank you.
Thank you. Thank you for your comments.
Hi there. This is Diane Kozer at 5872 Harbor South Drive in Winnebago.
Thank you.
I'm very angry about what's going on in our county right now. Effective leaders do not govern by overpowering, ordering, commanding, fining, tracking, removing people from their homes, or by arresting the people they represent. As our representatives, you should never have that extreme level of power over us. You work for us. Your repeated attempts to pass amended 1108 in spite of overwhelming opposition are wrong. We deserve honest, forthright representation from you, but instead we again face your blatantly manipulative, excuse me, attempts to remove our right to make our own health choices. You repeatedly force us to fight you to maintain those rights, and that is not effective leadership. Do not presume to know what's best for us. You were not elected to control us. While making recommendations about public health is good leadership, it is an absolute abuse of power to order us. Why would any decent leader want that level of power and control over people? Extreme attempts to control this virus have clearly not been successful, even though people have been masking, distancing, isolating, testing, and more for way too long. If these restrictions are really effective, why is our county supposedly the national hotspot for COVID? Do I believe that the numbers are being intentionally manipulated and inflated? Yes, absolutely. Will there be accountability for the extreme harm this is causing? I'm counting on it because no one is above the law. I expect you to vote against passing amended 1108 and not bring it up again. I also ask that you vote no tonight on the county employee hazard pay bonus resolution. Passing it would be very inappropriate considering the significant financial hardships many citizens are currently experiencing. Thank you.
Thank you. And thank you for your comments. Next speaker is Pat Halquist. If you could state your name and address for the record, please.
Okay, I'm Pat Dwyer Hallquist. My address is 2030 Hazel Street. I too am a citizen of this county, and I disagree with some of our previous speakers who feel that they represent the majority of the people in this county. I'm not sure they do. They are more vocal. But anyway, I support the amendment to section 11.08 of the Winnebago County Code referring to the county health officer. COVID-19 is real. I checked the numbers this afternoon, and within the district represented by the Winnebago Health Department, there have been 43 deaths since the start of this epidemic. There's currently greater than 1,000 active cases, and greater than 6,300 people have confirmed diagnoses. There's no reason to think these numbers are being manipulated. If you look at the website, if you look at the definitions, and if you've heard people from the county health department talk, you realize that these are people in our community also concerned about our community, and they have no reason to lie to us. ICU beds in the Fox Valley HERC district are almost 90% filled. You don't trust the people who run our hospitals that they're lying about that? That just doesn't make sense. I'm sorry. These numbers represent people who've lost weeks of work, may have long-term health problems, and they've lost relatives to this. Given all that, there are legitimate concerns about the impact of this on our economy, on people's jobs, and on our local businesses. What the louder voices about this, protesting any action by government, is they think their businesses will be better off if the county health officer is not allowed to take actions. Despite the overturn of the safer at home orders last May, 5 months ago, we still have a problem with this virus. There really have not been effective government action. It's all been voluntary. The mask ordinance by the state is still in effect, but it has so many exceptions and is not enforced that it essentially hasn't had an effect. There are businesses that I have supported for decades that I no longer go to because they do not have safe COVID-19 processes. I am not the only one who feels this way. The reason businesses are struggling is because people are unwilling to expose themselves to this virus, both for their own safety and the safety of their family. Okay, in the end, I'm asking the supervisors to realize that the more vocal people are not necessarily the majority of the people in this county, and I ask you to please approve the amendment to section 11.08. Thank you for giving me time to talk.
Thank you. Thank you. Thank you for your comments. Next speaker is Andrea. Please go ahead, and if you can state your name and address for the record, please.
Andrea Marsh, 633 South Park Avenue, Neenah. I sent an email off to all the supervisors that had an email listed. So the couple of you that didn't, this may be new. The rest of you have heard my feelings about this, so I will be brief. My concern with passing the amendment is not about the current situation. It's not about COVID and what we need to do to control it. Everyone agrees that it's a crisis. Everyone agrees that it's a problem, no matter if you believe the numbers or not, no matter if you believe in the shutdowns or you think everything should be open. That's not what I'm here to discuss. What I'm here to discuss is a power overreach. We are in a time of crisis. When anyone is in a time of crisis, that is not the time to be making life-altering decisions. Passing this amendment is making life-altering decisions that can potentially alter the lives of those that reside in this county currently and those that will reside in this county in the future. This ordinance allows for the disinfection of people. I don't even know what that is. It allows for the quarantine of people and places. It does not allow anyone to interfere with an active investigation, meaning if my child is suspected of something, or let's say in this case has COVID, and the county wants to remove them, I am supposed to stand there and allow my child to be removed from my home, and I have no immediate recourse. I probably do later, but not in the moment. You are going to fine people and businesses. Each day is its own fine. Completely and totally unacceptable. Maybe there are things that need to be done in this county, but this is not the way to do it. We are in a time of crisis, and we should not be making decisions that will affect people going forward in the future for years and years to come. This is not just about COVID-19. These rules would apply to any infectious disease. That's the flu. That's the common cold. That is essentially every disease that there is out there that can pass from one person to another. This is 100% unacceptable. And I implore you as elected people of the county that you are representing, that you vote this down, because this is not acceptable. This is a complete and total overreach, and it's just not the right decision to be made at this time. Thank you.
Thank you. And thank you for your comments. Next speaker is Tamar Mathwig. If you could please go ahead and state your name and address for the record, please.
Tamar Mathwig, 895 Michigan Street, Amro.
Thank you.
Okay, I'll be quick. All right, transparency. It's time for the board to meet in public again. Now, you can't silence us any longer by meeting on Zoom. Zoom allows us to be muted by the board members and therefore is taking away our voice. Also, it allows you to illegally communicate on phones or whatever during the meeting, which I don't agree with either. Also, in regards to 1108, as a Winnebago County citizen, we'd really appreciate if you would stop threatening the things and the people that we hold dear. That's how we are perceiving what you are proposing. So our homes, our businesses, our schools, our families, we don't want to live in fear of you. You're a board, you're not our king. It's not like that. You are supposed to represent us. Also, if there's any board members who think this isn't going to affect you, you haven't read clearly the 60-page guide that was given to you. Okay, so if you, a board member, if you're a parent or a grandparent, maybe you have grandchildren who go to school, you have to know that this will eventually affect them. So stop and think before you vote. If you vote this ordinance in, your grandchildren could be at school and may be suspected of having COVID-19, and they could be dragged away without their parents' consent to a place designated by the public health officer. Speaking of the 60-page guidance on implementing regulations put out by the Wisconsin Counties Association, if anyone in the community wants a copy of that, Sue Ertmer, the county clerk, has a copy of that. Hugely alarming language in there. I hope everyone gets a chance to quickly download that and read it, specifically pages 28, 29, 14, and 15. It says, what if a person refuses to allow the quarantine to happen? Okay, this is the part where it gets really scary about talking about employing quarantine guards to execute the local health officer's isolation and quarantine orders. It's important to note that quarantine guards may be employed with or without a court order related to isolation. A local health officer shall employ as many persons as are necessary to execute his or her orders and properly guard any place of quarantine. The person shall be sworn in as quarantine guards. They shall serve with police powers and may use all necessary means to enforce both state and local laws. DHS guides that quarantine guards are usually existing law enforcement officers. However, they may not be the best candidates depending on the circumstances. Gee, is it because maybe they know the difference between right and wrong? If a person refuses to comply with an isolation or quarantine order, even after the assistance of the quarantine guards, the local health officer may issue a violation order to remove the person and confine them. It goes on to say that the health officer may prohibit anyone from visiting these people in their quarantined location, which is not specified. All other people are forbidden to be in direct contact with the patient that the local health officer orders to be in quarantine. You are talking about
please work to conclude your remarks.
Yes, I will in a minute. You're talking about taking children away from their parents and not allowing.
Please work to conclude your remarks.
And you are not allowing parents to have contact with their children. Board members, that should scare you. Thank you.
Thank you. And thank you for your comments. Next speaker is Jared S. If you could please state your name and address for the record, please.
Hello, this is Jared Schwartz. I live in Neenah, Wisconsin. Can you hear me, sir?
Yes, we can hear you well. Thank you.
Thank you. Thank you for the opportunity to speak. I'm very concerned with their proposed language, which on their proposal, lines 90 and 91, when taken literally, simply state that under this ordinance, no person may interfere with an investigation of any place or its occupants by the Winnebago County Health Officer or his or her designees. Think logically, people. If you're in a quarantine in your own house, they have the right to come into your house. Think about the castle law. Think about some problems that you're willingly giving up. You're giving up your rights. They're taking them. Their language, not mine, on line 90 and 91 says they will have the ability to go into any place without interference. That's under their control. That means a quarantine facility. They also state in state statute 25206, section 10B, the county or the municipality in which a person with a communicable disease resides in is liable for the following costs. We're putting this on our county's budget to pay for their decrees, the expenses of employing guards, okay, that's sub point 1, the expense of maintaining quarantine or enforcing isolation of the quarantine areas, section 2. Can you hear the costs racking up to our county? They also talk about quarantine guards. Great mention of that earlier. The cost of those guards is, again, the county or municipality responsibility. It's in the state statute. It's in their records. It's in their documents. Last but not least, the CDC had some recent research out there. It's available if you're interested. They had 154 people that were diagnosed over the age of 18. 108 of those people always reported wearing a mask 14 days before symptoms set on. 22 more of those people reported wearing it often. That's a total of 130 out of 154 the CDC investigated that always or often wore their mask at least and up to 14 days before symptoms set on. You think masks work? Do some research. Thank you for your time.
Thank you, and thank you for your time. Next speaker is Katie Campbell. If you could please state your name and address for the record, please. Please go ahead.
You see me okay, everybody?
Yes.
Mr. Ramos, thank you. All right, my name is Katie Campbell. I live at 614 Wagoo Avenue. Ideas are backed by people who live by them. To paraphrase Barry Weiss, a former New York Times opinion columnist who quit this year, her resignation letter focused on calling out the corruption of the Times and pleading her case for truth in journalism. To everyone on this board, I really hope you live by what you say. For there are many people in the public eye that don't. The hypocrisy in this community and this country is astounding. Propaganda and public relations are controlling the mind. I really want to go back to life before COVID. I think we all do. When we lived in a world where a virus was not the fault of a person, but of nature and of God's responsibility. Before COVID, I was simply a mother of 3, minding my own business, simply loving my kids and teaching them truth. Occasionally, I would get together with friends and family, and on Sundays, my husband and I would go to church. I chose to give up a well-paying career to homeschool my kids because I saw the virtue in it. But by doing so, I gave up a second income. So now my husband and I challenge ourselves by living off one income, and we live simply. We do not take big vacations, and we don't have super nice things. We chose a fixer-upper home in what some of you have called a blighted area of Oshkosh. Where you saw problems, we saw opportunity. I want to go back to a life where people were not to blame for a virus. I want to go back to a life of forgiveness. And I've realized now that I took that for granted. Before COVID, if I got sick unknowingly, I happened to be around others, I would feel comfortable calling those others up and letting them know that I was sick and I'm sorry if I spread it. And guess what? They would forgive me. Now it's different. Conservatives now become the easy target as the cause of a spread for COVID. And our punishment? Well, I guess a public health officer seems like an easy meal ticket. Where's the forgiveness after this is passed? As public servants, being independent and holding a nonpartisan position, you should not mean you should lean left or right in discernment. You should be contemplating truth. And if the items being considered for law align with goodness, for there will be consequences down the road for laws not grounded in virtue. If you are on this board and you think you have truth and your ears are turned off to learning and gaining knowledge, you are acting as your own God and you shouldn't be on this board. In this crucial time, we need more people of courage to challenge the public thought, for the private thought is being self-censored. Too many people care too much about what others think of them. Thank you, social media. As a Christian, it's my job to stand up for God before the government or anyone, and not to be ashamed nor afraid. I personally do not care what any of you think of me. I care simply that by passing Ordinance 11.08, you are perverting liberty, marring it, subjecting it to fear and loathing. Thank you.
Thank you. Thank you for your comments. Next speaker is Mike Brown. If you could please state your name and address for the record, please. Mike Brown, if you could please state your name and address for the record, please. We're going to go ahead and move on to the next speaker, but we'll give him an opportunity later and hopefully he'll be able to speak. So we're going to move on to the next individual. There is no name. It's a phone number. It says 1920 with some stars and then 221 guest. If the individual at that number could please state their name and address for the record, please.
Hello?
Yes, if you could please
Hello?
state your name. Yes, we can hear you. You could please
Okay.
state your name and address for the record, please.
It's Heidi Pedon, 1732 Skyview. I'm calling to urge you to vote against the amendment to section 1106. The current health officer code's failure to grant the health officer power to enforce orders is not a glitch, but rather it's a purposeful intention of the governed to retain their rights. In other words, you do not have the consent of the governed. Tyranny in the name of public health is still tyranny. The people are being asked to give the power of enforcement to the health officer with board approval and trust that it won't be abused. The case of the local dog groomer points to the fact that this power can and will be abused. While COVID-19 is a source of concern and some fear, I'm much more afraid of the loss of freedom that it seems to leave in its wake. Voluntary compliance with mask wearing, limited socialization, and sanitation seems to be pretty high. What more needs to be done? Do we want to become a county where people report their neighbors for assembling with others in their homes or yards? Do we want authorities removing people from private property or punishing them with loss of license and livelihood? Is this where we're headed? History shows that this sort of oppression is not unusual or an absurdity. Obviously, this virus is causing severe illness and death, but we need to recognize that many of us have lost loved ones because of the shutdown and not the virus. Our duty to protect the vulnerable and frontline workers must be balanced with the need to protect our freedom, mental health, livelihoods, and humanity. There has been no expert in the world who has had the perfect response to this virus to date. Why should we trust that the Winnebago County Health Officer has the right answer for all the citizens of Winnebago County? The officer's job is to educate and advise. The job of a free people is to exercise personal responsibility, common sense, and respect for others. Thank you.
Thank you. Thank you for your comments. Next speaker is Lois Grutzmacher. If you could please state your name and address for the record, please.
My name is Lois Grutzmacher, 3576 Leonard Point Lane in Oshkosh.
Thank you.
I'm a retired public health nurse for a short period of time. I also was an interim health officer myself. I just want to make sure that everyone is remembering the basic fact that this is not a COVID ordinance. It's a communicable disease ordinance, and it needs to be in place for locally effective control of all communicable disease for many years in the future, just as it has been in effect for decades under state statutes. There's nothing new here. I keep hearing you want to give the health officer some new powers, and you can't have one person, you can't give one person this kind of power. For decades, please understand this, for decades, every health officer in every county in this state has had the powers that we're talking about. And there is no power grab here. It's based on existing state statutes and Wisconsin Administrative Code. The ordinance itself that they're proposing references the state statutes and the administrative code over and over again. These are the rules that all the health officers have operated under for decades in this state already.
The authority has only ever been used to restrict persons to the extent needed to protect others in the community. That's what public health is all about. And they take the course that's the least restrictive of personal freedoms. It's pretty unfortunate that our elected officials are drumming up fear in the population here instead of fully explaining what this whole thing is really about. If we aren't, another thing to remember is that if we aren't able to locally control communicable disease here under statute, the state health department will come in and do it for us. And then they'll come and get all up in our business, do what they have to do.
If you could please work to conclude your remarks.
Yes, I will. And then they will turn around and bill us for what they have done for us. So I'm just asking that the board not be so short-sighted as to fail to see that COVID will eventually be in our past, but we'll still have all the communicable disease that needs to be controlled in our community. And don't be put off by all this opposition, because that's the nature of public health. That's how we operate. We're damned if we do and we're damned if we don't. If we control the disease, we're wrong because of the way we did it. If we didn't control a disease well enough, why aren't we doing our job? That's just the way it is with public health. So don't be swayed. Do the right thing and pass this ordinance, or we will be in one sorry state here in Wisconsin.
If you could please work
Thank
to
you.
conclude. Thank you. Thank you, and thank you for your comments. Next speaker, we're going to try Mike Brown again. Mike Braun, if you could please state your name and address for the record, please. Please go ahead, Mike Braun. If you could state your name and address for the record, please. I'll ask one more time, Mike Braun. Your mic is open. If you could please state your name and address for the record, please. Okay, we'll go ahead and move on to the next individual, and that's Candace L. If you could please go ahead and state your name and address for the record, please.
Candace Leach, 6489 Jaberke Lane, Neenah, Wisconsin.
Thank you.
I have a couple questions, and I know that they're not going to get answered in this time, but something for us to think about is that this country is for, on the premises of we the people, by the people, for the people. Why is this something that we are not able to take a vote on as a county to see if this is actually an amendment that we want to have passed or not? When we are looking at this amendment, this person is unelected. What are their qualifications? Who is picking this person? How are they going to decide who or, how someone violates the ordinances? What if you have a neighbor that gets upset with another neighbor, or someone gets upset with a business owner and then calls them into the health department? What are the ramifications for that person if they lie, just to turn that person in and get them in trouble? I mean, the fact that there is so much open, there's so many undefined areas to make this a wise decision for a county as a whole to be put on one person. Let's see. And this is also based on a virus that has a 99.6 percentile for a survival rate. This is a virus that's going to be around like the flu, like the common cold. The other issue is that as businesses, we are not able to, nor should we be required to ask people what if they have a medical exemption. Are we throwing the medical exemption out the window where people that have medical exemptions are not able to even go outside of their house? I mean, wearing a mask increases PTSD, increases breathing issues, asthma attacks, anxiety, panic attacks. There are people out there that are accusing other people of just standing up for their rights, but they're also standing up for their health, the health of themselves, the health of their children. We're not trying to fight against everybody or each other here. We should be unifying as a county and country as a whole, but this is not the way to do it. It's not the way to do it to have this be such an open-ended amendment where there is power for one person to make a decision to be able to come into your home and take your child away, or maybe even take you away from your children, just because they may have COVID, because it's, they're sick. The COVID symptoms are so generic that you could have the flu and someone's going to assume that you have COVID. This isn't right that you guys that one person, one unelected person is being put in charge of this, and that the fact that you as board members are not putting this to a vote to the county as a whole to actually find out what our say is, what your people who voted you into your office have for our opinion on this. And that is all I have to say. Thank you.
Thank you for your comments. Next speaker, we're going to try one more time for Mike Brown. Mike Brown, if you could go ahead and state your name and address for the record, please. Unfortunately, sir, you are unmuted, but for some reason, probably some sort of mode on your computer, your mic must not be working, because I can certainly see, sir, that you're trying. And we do have you unmuted, but it obviously is not coming through, so I certainly apologize for that. We'll move on to the next speaker, and that's someone listed as M&M Pelco. If you could please state your name and address for the record, please.
My name is Marilee Pelco. I live at 4633 Oregon Street in Oshkosh. I would like to talk about the resolution concerning hazard pay for county employees. Unless those employees are directly working in the hospital, ER, ICU, or working in testing centers, I don't understand how you can say that they have been working under stressful conditions, etc. I work in a medical facility and I have not missed a single day of work in the office during the last 7 months. Stress is in March calling all of our patients that have waited months or weeks for an appointment with their doctor and telling them they can't come into the office for an undisclosed amount of time because there's a scary virus out there that might kill them. You wouldn't believe how many times we were yelled at. Then in May, call all of them back and convince them that now it's safe to come back into the office. Did I or my coworkers get any additional compensation for that? No. My son, who is a single father, works the famous Bemis swing. Not only is he working 12 hours a day, but now he has to homeschool his 2 boys because they're not allowed to go into the school. Is he experiencing less stress than the county employees? No. My daughter's working mandatory overtime and her husband is working full-time. They have 1 child in daycare and another in 3rd grade. She is physically making herself sick trying to get the best education for her 3rd grader who is falling behind in school. She has to take him to 3 different homes each week just to keep him engaged. Is she getting any additional compensation for her stress during this virus situation? No. We are just one family out of all the families in Winnebago County. How many more are struggling every day just to make it through the day due to all the chaos that's going on? Families are stressed over their kids not getting a decent education, over losing loved ones in the lockdown, or stressing over the interaction of their loved ones. How about those that are losing their businesses and jobs? How many of these families are being compensated for their struggles? None that I know of. I also know how many people have been furloughed and laid off and are getting an additional $600 per week to stay home. And I understand that that's from the federal government, but still they are being rewarded for not working. How is that fair to those of us that have worked all the way through this and haven't gotten any compensation? Why are the county employees any more stressed than all the rest of us essential workers who have gone to work and juggled family life every single day through this? We are talking $550,000 of taxpayer money that is not being spent on the citizens of Winnebago County. taxes that we have to pay as homeowners. If you feel the need to spend this reserve, why not put that money into the county and open our schools back up, and let's get back to our lives. And I just want to say to Pat, who spoke earlier, the numbers are a lie. They put COVID on my mother's death certificate and she didn't have it. Thank you.
Thank you. And thank you for your comments. Next speaker, it's a phone number again. It's 1920 with a number of stars and then ending in 421. If that individual could state their name and address for the record, please. It's the individual on number 1920 stars 421. If you could state your name and address for the record, please.
My name is Lee Cranville. Can you hear me?
Yes.
I live at 5923 Grandview Road in Larson.
Thank you.
My wife and I have been residents of Winnebago County for over 38 years. My comments are going to be more in the way of questions for the board, and it's going to go a little bit further up the tree into the trunk of the tree. And I would like to ask them, how would your proposal affect our First Amendment rights? Second of all, I would like to know if your board members have all signed their oaths of office that they are required to do when they took office, and whether they're familiar with what they signed and what the words were. And if they haven't read the First Amendment, I strongly suggest they go back and do it, because the word of the day for this meeting and for this ordinance is overreach. Thank you.
Thank you. Thank you for your comments. Next speaker is Lori. And if you could please state your name and address for the record, please. That's Lori. Please go ahead, Lori. If you could state your name and address for the record, please.
Yes, my name is Loretta Chemis, and I live at 1461 Deerwood Drive in Neenah.
Thank you. Please go ahead.
I would like to please ask you to vote against Amendment 1108. I do truly appreciate the efforts of the health department at this time in trying to combat this communicable disease. I know that they're working long hours and overtime, and I realize what they're going through. I too am a retired person from a health department, but this is just giving too much power to the health department director, and the fines are just way too harsh. And I don't understand the reason for a special inspection warrant that gives a health officer and its authorities to enter private property and private residence. I find this to be very invasive and abusive. And I've gotten a lot of information just from listening tonight. In my opinion, this amendment is overreaching into government control. And I believe it's also a violation of our civil liberties. Please remember that 97% of the population in Winnebago does not have or did not have the COVID. And if I'm not mistaken, I believe that the CDC themselves said that 75 to 80% of people that did get the COVID were compliant with all the regulations and the social distancing and the wearing of the mask. And I'm just against this. Please don't vote according to what the board desires, but please rather vote according to what the citizens desire. And I appreciate your time. Thank you.
Thank you. Thank you for your comments. Next speaker is James W. If you could please state your name and address for the record, please.
James Wickersham. It's 3377 Wyatt Way, Oshkosh 54904.
Thank you.
So I've heard a lot, and I've heard a lot of good things because people are talking about freedom, liberty. I've heard some other things, but this is a draconian measure. It's may have been in place in Wisconsin before, maybe under other statutes. That doesn't make it right. It's wrong in general. The other thing I'll say is this is a measure that leaves power open to somebody unelected, as we've heard, but those unelected officials gain power. They don't ever give power back. It just stays and grows. And if we're concerned about the deaths of COVID, I'd be concerned about the deaths of what a totalitarian state would get you. Maoist China, Soviet Union, millions of people dead because of political ideas like this. That's about all I have to say on that.
Thank you. Thank you for your comments. Next speaker is Tom Hallquist. If you could please state your name and address for the record, please. Please go ahead. Sir, you're unmuted, but it looks like your mic is not working on your end. Sir, we're going to go to the next individual. We'll try to call on you again a little bit later. So we'll keep your hand raised. Sometimes you have to actually log in and out and ensure that your mic was permitted to access during the call. So we'll keep your hand up, but we'll move on to the next individual. That's Renee Isley. You could please state your name and address for the record, please. Please go ahead.
Hello, can you hear me?
Yes, we can hear you.
Hi, I am Renee Isley, and I live at 3867 Western Drive in Oshkosh, Wisconsin.
Thank you.
Thank you. First, I'd like to thank you all for listening and letting me speak tonight. Second, I'd like to say how disappointed I am that you have moved all of your meetings to Zoom. I see this as a way to suppress the voices of the people of the county for which you all represent. I'm here to discuss the Amendment 1108 for the county health officer that you will be voting on later tonight. You removed this issue this summer plenty of times because you were met with such opposition from the public for your in-person meetings. And now you have snuck it back in the agenda for your Zoom meetings, knowing that many people do not have access to the internet or may experience technical difficulties like we have already seen in tonight's Zoom meeting, and therefore they are not able to voice their opinions with you. As a resident of Winnebago County, I do not agree with giving any health officer such tyrannical powers like in the new amendment to section 1108 of the General Code of Winnebago County. I see this as a huge overreach of power by the Department of Health and a special inspection warrant that allows taking away individuals and any items that they may deem infected with any communicable disease from a home, finding individuals each time and each day they violate, and taking away licenses from businesses whenever that one official deems necessary is not right. I urge you to please vote no in passing this amendment. I also ask that you vote no on the resolution number 097 for the hazard pay. I see this as a slap in the face to many frontline workers who have faced this virus head on throughout this entire pandemic, whether they work in the health field or the grocery stores and have no other choice but to pay their bills by going to work. We, the people, have hired you all for the county board to represent us. The government works for the people. I do not agree to give up my civil liberties for a temporary sense of security. Thank you.
Thank you. Thank you for your comments. Next speaker is Jared Longshine. If you could please state your name and address for the record, please.
Yes, my name is Jared Longshine. My address is 132 West 25th Avenue in Oshkosh, Wisconsin. So if anyone's looking to send me pizza, I will take it. Nonetheless, obviously this is a hot button issue, and I'm a pastor in the county besides just a resident, and so I can feel empathy towards those who are in leadership trying to navigate through these troubled times. And I know a lot of people have a lot of strong takes on this one way or another, but my perspective on this is that we're looking, as one news article stated it, to fix a glitch. In other words, the glitch is that we didn't have enough power entrusted into the Winnebago County Health Department. And from my perspective, maybe it's more libertarian in nature, is I think that's a great thing. I don't want the Winnebago County Health Department having any more power than it should. In fact, I don't want you guys having any more power than you should. In fact, I want a government so small, I barely notice it exists. And I know that's impossible today with these massive governments and all that, but the reality is we should be looking for solutions that are outside maybe the norm. And I know that you guys are used to working on infrastructure and things like that, but can I ask, can I plead, can I beg that you guys would look to do something unique and courageous, vote down the extended powers. I know some people are debating what they are, but vote down this fix of a glitch for the Winnebago County Health Department. I plead with you, I ask that you guys would seek out a community solution to this community problem. The solutions that are going to be in this item you guys are voting up or voting down is going to be permanent. This isn't just a COVID issue. This will be a permanent issue that not only myself, but future residents of Winnebago County are going to have to deal with. And as a pastor, I'd be first one in line to be a partner in coming up with solutions. I know not everything falls my way, but we haven't been afforded the opportunity to even talk about what kind of compromises we'd be willing to have. But as a libertarian, as a pastor, as a person who loves freedom, I want less power for the Winnebago County Health Department. And I'm sorry for those who are sick, sorry for the COVID that's out there, but community problems need community solutions. So I'm praying for you guys, ask you vote it down, and wish you well.
Thank you. Thank you for your comments. I'll try again on Tom Hallquist. If you could please state your name and address for the record, please.
Hi, I'm Tom Hallquist. Can you hear me?
Yes, we can hear you well.
Okay, I live at 2030 Hazel, and I'm a strong supporter of this ordinance. My mother was a public health nurse back in the 30s, and that's when you had sanitariums. You had TB sanitariums because you had no drugs. She would spend her time with families of a kid with whooping cough that wasn't going to make it. And since then, we've developed a lot of drugs that control most things. The statutes date back before the 30s. The only two areas where you would probably have quarantine would be if there was a extended multi-drug resistant TB or a totally drug resistant Staph aureus. And so as a communicable disease, these are the types of things that if you read the books, Deadliest Enemies about pandemics, written in 2017, that we're concerned with. Otherwise, most of the ordinance, most of the statutes, most of the power already lie in state statutes. So there's nothing new, and Nurse Grissmeyer stated that. But the other thing is, when I drive down the street, I see a state policeman, a city policeman, and a county policeman. I don't see this fear of 3 or 4 public health nurses going to come breaking into your house. I mean, these people are very nice people, and they're going to basically call up and say, hey, we've got this issue with your business. Can you correct it? And then when they're talking about
to conclude your remarks, sir.
Sure. So basically, I think the messaging that I hear from my experience of having a public health nurse back in the time they were quarantined, I think everybody's overreacting. I think this is just finalizing what's already in the state statutes, and I strongly support it. Thank you.
Thank you, and thank you for your comments. Next speaker is Victoria Olson. If you could please go ahead and state your name and address for the record, please.
Hello, my name is Victoria Olson at 4961 County Road F in Omro. I will keep my statement brief. I first of all want to thank you all for your service and your efforts during the pandemic and before. I do appreciate public service. I wanted to, first, it's kind of based as a question based on some of the comments of people that are supporting the ordinance 1108, the amendment to 1108. If all these things have already been in place, then why wasn't there anything on the news, the local media, for the government to, well, local government, to clearly explain why the amendment was put in place? Because when I first read the amendment that came out a few months ago, I was in complete shock. It seemed to me that it was a complete overstep of our privacy and our health choices. So if that truly isn't the case, then why isn't there somebody out there on the news or on the media somewhere explaining the exact intention behind the amendment? So if that's not done, but you guys will have public comments on the board meetings, then why aren't we getting any feedback or reassurance or maybe some different wording in the amendment so that there's some boundaries put in place so that the people that you serve in Winnebago County feel comfortable for you to serve and protect us, just like the police officers, just like every other officer. I understand the health officer already puts in place many different things for restaurants and bars to operate safely for our citizens, and I appreciate that, and I don't think this is any different. However, it's very open-ended when all of us citizens read it the way it is written. And it's, frankly, with everything going on in the world right now, it's scary. People don't want any more rights taken away. People don't want to be told that there's a possibility of being separated from their children or their children being taken out of schools, or that it's so open-ended that possibly a mandatory vaccine could be pushed through. Your mind can wander and your imagination can wander. So why don't you make it clear and concise of what this intention is so that the people of your county can feel comfortable? Thank you.
Thank you. Thank you for your comments. Next speaker is, it says Tim and Joan Patterson. If you could please state your name and address for the record, please. The individual at Tim and Joan Patterson, if you could please state your name and address for the record, please.
Sorry, we're having an issue with unmute. I am Tim Patterson and I live at 2430 Parkside Drive in Oshkosh, Wisconsin.
Thank you.
Yeah, I had an opportunity to speak last week as well. Greatly disappointed that we are taking the opportunity to abandon the Constitution, the Bill of Rights, search and seizure laws, HIPAA laws, that we are giving authority to non-elected officials. And we are leaping to adopt this when we have, what, less than 1% affected? That we are abandoning what it is to be American because of such a low percentage of people that are being affected by this right now. I understand that there are people that are afraid. I understand, I respect that. I know what it's like to be afraid. But one of the things that is helping to make this work is the fact that there is trust out there. People are voluntarily testing because there's trust out there. If you vote for this, people will stop trusting our county. They won't trust our government because as soon as you identify yourself as somebody who has it, now you're putting yourself under the radar screen. Now you're subjecting yourself to fines. Now you're subjecting yourself to businesses being closed. So as soon as you get rid of the trust, you'll see a drop in testing. People won't care. They'll, whatever it is that we have achieved on the positive end of this, yeah, the numbers are bad. But remember, we're very low percentage of this county is affected. Extremely low percentage of this county has passed away. So I know in my previous experience, I've had to make difficult decisions. I know this is a difficult position for the county board to be in. But any decision I've ever had to make in my walk of life, I had to respect a code of conduct. I had to respect the rules of engagement. And I'm greatly disappointed by any board members that are so willing to get rid of what I will call the civilian code of conduct, which is known as, again, as the Constitution, the Bill of Rights. I seriously question your maturity and training in order to sit on the board. Greatly disappointed. Do not vote for this amendment. Thank you.
Thank you. Thank you for your comments. Next speaker is Matt Dvoracek. If you could please state your name and address for the record, please.
Hello, can you hear me?
Yes, we can hear you.
All right, my name is Matt Dvoracek, and I'm pastor of Victory Baptist Church on 608 Jefferson Street in Oshkosh. And first, I thank you for the opportunity to speak. And I appreciate, to the board, I appreciate your service to our county and to our community. Little background information, I moved back to the Oshkosh area in 2016 after having been away since 1999. In the 90s, I was a student at UW Oshkosh. I also worked part-time actually for Winnebago County GIS department and the kind of when the Wings project was in its infancy. But I'm expressing concern this evening with the proposed amendment to 1108. And I believe, and I know many of our congregation do as well, that this ordinance gives undue authority to one person with the potential to greatly affect many lives. I believe our county has largely been responsible in following health recommendations concerning COVID-19. We're all concerned about this recent uptick in COVID cases. I acknowledge the hospitals are near capacity. That's real. It's happening. I think this was somewhat predictable with the return of college students. More people spending time indoors, that sort of thing. We saw it happen down south over the summer. This uptick occurred with the mask mandate already in place. California's wave over the summer took place right in the middle of a strict lockdown. Many are talking, or those say now that the lockdowns are not have not been effective anyways and shouldn't be done. Currently, according to the Wings COVID dashboard, there's currently 1,155 active cases. Though this is a concern, I'm concerned about everybody. But it's still just over 1/2% of the county population. So I believe this is, like many have said, I also believe this is an overreach of power and encroachment on our freedoms. It's not only unnecessary, it's immoral. The Bible says in Proverbs 28:2, for the transgression of a land, many are the princes thereof, but by a man of understanding and knowledge, the state thereof shall be prolonged. When a community is not trusted to live righteously, there becomes, or there at least perceives the need for more regulation. And that is one of the reasons our church exists, to help people by the grace of God in Christ Jesus to live righteously, so our government doesn't think they need to try to do it for us. In my humble opinion, the various shutdowns have already had a negatively affected more lives than the virus itself has. And putting this kind of power in the hands of one unelected person is dangerous and would display a great lack of trust in the citizens who voted you into your position. I would like a general no vote before, respectfully, sir, you mentioned possibly an amendment concerning businesses. If you would not vote no, which I greatly encourage you to, if you would not, perhaps you would include churches as a consideration for an amendment as well, not just businesses, but I appreciate you thinking of businesses as well. But let's work together to encourage righteous behavior in our community rather than increasing power to one person to control them. So I'd strongly encourage you to vote against this proposed amendment. Thank you and God bless.
Thank you. And thank you for your comments. Next speaker is, the name says M. Thoma. M. Thomas, perhaps, if you could state your name and address for the record, please.
My name is Thoma, 1809 County Road A, Neenah, Wisconsin.
Thank you.
I'm speaking today to implore all the county supervisors to vote against the amendment to 11.8 to the general code. Where do we start? I've heard some comments where this is not changing anything, which obviously that's simply not true, because if this were not changing any powers, we would not be talking about an amendment. So that's simply not true. Let's see. The health officer is an appointed position by the county executive, whom is spelled out in this ordinance, shall serve at the pleasure of the county executive. It's kind of sounds disturbing. At least you got to admit there's a potential for conflict there. The ordinance gives health officers the absolute power to take actions on specific individuals or specific entities on no more than a mere suspicion of preventing communicable disease, so much as entering the county. The health officer's orders supersede any or all conflicting or less stringent regulations or orders. This is pretty much a dictatorship. Where are the checks and balances? No person may interfere with an investigation of any place or its occupants by the health officer or his designees. That's pretty scary. This ordinance gives a health officer's power to quarantine, disinfect, or any other means for control and suppression of communicable diseases. All of you should know that communicable diseases is quite a large and includes common things such as the flu, food poisoning, strep, Lyme disease, hepatitis B, C, chlamydia, gonorrhea, West Nile, AIDS. You get the point. We're not talking just in reaction to COVID-19. I hope none of you are taking comfort in the changes that reduce the control that were made to this ordinance from the first proposal, that a general order would have to be approved by the board, when clearly the health officer can just apply his desires under the rules of individuals or specific entities. I'm very scared that one person would be given this kind of power. This much power to prevent things such as the flu, food poisoning, strep, Lyme disease. This ordinance would allow the health officer to prevent people from going outside if the ticks were bad, under the rules that you could get Lyme disease. We have never needed to have a person with this much power or control. Why do we need it now? I ask you again, vote against this. Would also like to address the proposals given to give the county employees a one-time bonus due to the stresses caused by COVID-19. First, I would like to say all their hard work is appreciated. With that said, I still cannot support giving bonuses. The proposed bonuses would cost the taxpayers $550,000. We're all dealing with stressful times due to the pandemic. A lot of us, myself included, have been working throughout, not only with increased workload, but decreased pay. To give our taxpayer-funded employees a bonus would not only be another negative financial hit, but it would add insult to hardworking people whose places of employment can't simply raise taxes to reward its team members. So again, I ask you to vote that down. Thank you.
Thank you, and thank you for your comments. Next speaker is listed under the name John. If you could please state your name and address for the record, please.
My name is John Casper. I live at 2785 Lee LeMay Lane. I also run the Oshkosh Chamber of Commerce. I appreciate the opportunity tonight. First of all, I really want to be clear about something. Speaker before said that the chamber is against masks. We are not against masks. We encourage our businesses to adhere to safety protocols, many of which have gone way beyond the standards that the CDC has set. So, and on the side, we've sold 30,000 protective face masks to businesses. So, you know, I just want to be very, very clear about that. First of all, as I read the ordinance to the casual reader, it appears pretty unassuming. The ordinance would allow, however, the ordinance would allow very far-reaching general orders that, if enacted, would be broad in nature, that could significantly restrict and limit business operations. Right now, the way the ordinance is written, it's only really limited by the imagination of the public health department. The scope of what the health officer wants to do under this ordinance is incredibly vague. It states that the officer can create a general order that applies to a class of business or a class of people, things, or the county as a whole, but does not place any limitations on what that order can contain. Our concern here, again, I want to be clear about this, is having the health officer recommend any kind of an order that would impose things as far reaching as shelter, a shelter in place style shutdown. We're concerned about putting limitations on businesses in terms of the certain types of businesses, targeting those businesses and such. The active reviews portion of the general orders appear to be better in this ordinance than it was in past June. Requiring the county to vote on a general order before it becomes mandatory appears to be an improvement, but it's really not enough. The outer bounds of what an order can contain should be very specifically outlined in that order. The penalties section is also pretty alarming, especially the section allowing to pull county to pull permits, which really effectively can eliminate the individual's ability to earn a living. The individual provision that's allowed the public health director to act independently of any oversight is really subject to potential abuses and could be used to retaliate against targeted businesses. As I mentioned before, the proposed ordinance provides no definition of the limits for general orders and provides no specific metrics for when what could trigger that order, and provides no outward or outer bounds for that order itself. The proposed ordinance allows the public health director to really pick winners and losers. The general orders are allowed to be imposed, can select certain types of businesses to shut down or business operations restricted, and really effectively putting them out of business.
Please work to conclude your marks.
Real quickly, the last section, this was brought up before. The authority section is very confusing. Past speakers said that the authority currently exists because of state statute. Really begs the question, if that were the case, why are we even talking about this ordinance? You all received a letter from the law firm that we retained. It outlines a number of issues, specifically as it relates to those statutory specifics. I think they refuted most of those. We do share concerns that the health and safety of residents and businesses, but we see this ordinance as unlawful and therefore should not be approved. Thank you.
Thank you, and thank you for your comments. Next speaker is Jim Basler. If you could please state your name and address for the record, please.
Hi, thank you. It's Jim Basler, 1685 Burr Oak Road, in Oshkosh.
Please go ahead.
We still don't have any vaccines for some of the deadliest illnesses to the most vulnerable populations among us, many of which are still seasonal. There's no guarantee that a COVID immunization will even work. Do we simply mask up and social distance for the rest of our lives? Do we continue to give up our freedoms for the promise of health? I'll say I masked up a month ago when the recent spike began, kept social distancing, and still got COVID, as did many in my family and my extended family. Well, fortunately, we all recovered from mostly mild cold or flu-like symptoms with no complications. But yeah, we should protect the most vulnerable among us, no doubt about it. But we also need to allow those that are healthy to adapt to this new threat. And for those that have had it, like myself, my family, many of our friends we've seen with it, we've gained some new immunity, albeit maybe for just 4 months or so, maybe longer. But, for us, leave us from the controls that we feel are dangerous to our liberty and our economic health. Many of us feel this pandemic, it's just too politicized. And any power grab by local government is opportunistic. We've heard stories of health officials abusing their powers in other counties and other states. So I encourage you to err on the side of liberty in your decision-making about any new powers for all officials and the county health officer specifically. I also encourage you to shelve the ordinance until after this really politically charged season is over, until after appropriate limits are put into the language of the ordinance. Again, just err on the side of liberty. And thank you for the opportunity to speak.
Thank you. Thank you for your comments. Next speaker is the individual at Tracy's iPhone. If you could please state your name and address for the record, please.
Tracy Marochak, 7285 Meadow Ridge Drive, Pickett.
Thank you.
I wanted to talk today because I want to implore you to vote yes in support. First, I want to share that I have been a registered nurse for over 20 years. I am also a former public health nurse, and I was the planning section chief during H1N1 for the city of Oshkosh. I have no concerns about this ordinance. These have been on the books for a long time. This is about enforcement. It isn't about the initial things that people are talking about. In addition, the proposed ordinance has a check in place requiring the approval of the County Board of Supervisors for orders. We need to consider the facts here. The facts are that our numbers are skyrocketing. Local hospitals are full or almost full. New numbers of new cases are happening daily with an astronomical positivity rate. Winnebago County deaths are on the rise. I've heard, oh, well, it's only 1%. If it's your family member, it's more than 1%. It means a lot more than 1%. Too many people in our area are not masking. I've observed this myself. People are not limiting gatherings. I've observed this in my own neighborhood. And they're not following the quarantine or isolation rules. And this is why our numbers are going up. It's because they're not complying with these requests. The virus spreads before people know that they are ill through droplets in the air. If everyone was masked, spread would slow down, but they're not. We know from other states and countries that mitigation rules like mandatory masking and limiting gatherings have successfully lowered COVID-19 rates and deaths.
If you could please work.
Unfortunately, that's happening. And I'd like to also say that universities and schools are not the main source. At UW-Madison, there was an early rise in cases, but the university has successfully contained it within a few short weeks with masking, limiting gatherings, frequent testing, quarantine, and isolation. These draconian methods that people have been talking about work. Social distancing is what we have in our arsenal right now to be able to combat this pandemic. Utilizing these public health principles and interventions. Thank you.
Thank you. Thank you. Thank you for your comments. Next speaker is Jennifer Kozer. If you could please state your name and address for the record, please.
Can you hear me?
Yes, we did allow you to speak earlier, however, and
Yes.
we did say earlier that we were going to allow each individual one time to speak.
Yes, I have one quick thing to say that is not about 1108.
But I'm sorry, we're going to hold to the rules. I'm trying to be consistent with every individual this evening, so I'm sorry.
Chairman Ramos, I'm being harassed by my district rep, and I would like to tell you that quickly.
You can let me know that at another time. I'm trying to adhere to the rules. I told everyone, I'm sorry, but I certainly want to hear about that if that's the case, but we'll talk about that outside of the meeting.
I want Tom Snyder to stop.
We're going to move on to the next individual, and that's Laurel. Laurel, if you could please state your name and address for the record, please. Laurel, if you could please state your name and address for the record, please. Laurel? Laurel, we want to give you one other opportunity, and then we'll leave your hand up there and call again. But if you could state your name and address for the record, please.
Hi, my name is Laurel. Springbrook Lane, Amro. Can you
Please
hear
go
me?
ahead.
I would like to thank you for your efforts, but I can't. From how I see it, you are washing, not you personally, but the county board is washing their hands of us. When I say us, I say the citizens and the small businesses of this county. Your intentions are not honorable. You are throwing us to the wolves, and they just can't wait. If you can't see how terrible this is, then you should never have been elected. The reason I say that is because you are less than brave. Your cowardly response is to wash your hands of the people who elected you. So to defer to bureaucrats who care nothing for anything but their own existence. I love this area, but what business wants to be in this environment? So if you want business in the county, you will vote against it.
Thank you. And thank you for your comments. Next speaker is Catherine Suzuki. If you could please state your name and address for the record, please.
Catherine Suzuki, 1715 Woodstock Street, Oshkosh. Can you hear me?
Thank you. Yes, we can hear you well.
Okay. Please vote no to 1108. Amendment states that the Winnebago health officer may close schools and forbid public gatherings to schools, churches, places of employment, public buildings, private property, and other places when deemed necessary to control outbreaks, epidemics, and pandemics. First off, and if any Oshkosh Area School District board members are listening, please listen. I would like to thank all the teachers and staff for the effort they have put forth to give our students the education they deserve given the times. However, it is not enough. The virtual learning model was adequate enough given the circumstances during the beginning of this pandemic. Now our country has learned the risks and certain health conditions that pose a threat of the COVID-19 virus. We have learned that children are the lowest risk population. The risks of them getting sick are rare, and the risks of death are even more rare. The hybrid model and virtual learning model have brought upon many negative consequences to my child and also the children in our Oshkosh School District. Hundreds of schools around the Oshkosh School District have been full-time in person since the beginning of the school year. The school district of Amro has over 1,000 students attending in-person learning, and a total of 5 students have contracted the virus. No students or staff have died from the virus. Our students are falling behind. While many school districts around us continue to hold in-person full-time school, Oshkosh is providing for the 4th week in a row a virtual learning model. Coming from a parent who has had to navigate this virtual learning model, I do want to say thank you to all of the hardworking teachers who have scrambled to add assignments and pre-recorded videos to teach our students. However, it is not enough. Our students are bored, disengaged, and distracted by the lack of in-person traditional teaching models. Our children are falling behind. Each day we continue this virtual learning model. Parents are pressured to continue to work full-time jobs and teach their children full-time. Many children are attending YMCA programs, boys and girls clubs, and in-home child centers, where they are in close contact with their peers. And yet our
to conclude your remarks.
Yes, remains in a virtual learning model. All children in this district should have the opportunity to attend class full-time in person if their parents are comfortable with that. I'm urging you as a board member to please reconsider your decision and help our area and help our students get ahead instead of falling behind. We cannot continue to give any more power to someone to keep our students out of school. Thank you.
Thank you. And thank you for your comments. Next speaker is Joni Beam. If you could please state your name and address for the record, please.
Joni Beam, 420 Jackson Avenue, Amro, Wisconsin.
Thank you.
DHS Secretary Designee Andrea Palm tried to order and enforce stricter and more extensive safer at-home orders, which were declared unlawful, invalid, and unenforceable by the Wisconsin Supreme Court in May 2020. In June, counties were being told they need to create an ordinance to control this COVID-19 pandemic and appoint an enforcement officer to execute the very same things the Supreme Court ruled against in their county, or their county may face financial consequences. At the Board of Health Committee meeting, you were all informed that this is in response to the Palm case. That, in my opinion, sounds a lot like a threat. Protect you from potential monetary risk Winnebago County may endure. If you don't, seriously, have you read the Wisconsin Legislator versus Andrea Palm case? If not, you should. Here are some of the highlights to consider from the 161-page ruling. You all are voting to pass an amendment 1108 to the Wisconsin State Statute 252 that was ruled unlawful, invalid, and unenforceable. Page 5, Palm issued a safer at home order that was going to punish people 30 days imprisonment or up to $250 fine or both to citizens who disobeyed her sole authority vested in her. You are voting Tuesday to allow Mark Harris to appoint an unelected someone to do the same thing. Page 14, 24, Palm is an unelected official. Page 18, 31. However, under Palm's theory, she can implement all emergency measures necessary to control communicable diseases. Wisconsin State Statute 252.026, even at the expense of fundamental liberties without rulemaking, open-ended grant of police powers to an unconfirmed cabinet secretary. Page 2547, 252.026 does not have the specificity required for fair notice of the conduct required or prohibited. Page 2649, she also prohibits all public and private gatherings of any number of people that are not part of a single household or living unit. This directive is not based on persons infected or suspected of being infected. Any enforcement of COVID-19 directives, which the Winnebago County Board of Health will create after this board tonight approves it, will be detrimental to social, economical, and mental effects. Yes, you heard me. The specifics of the directives to keep us safe come after this approval tonight. Businesses, schools, nursing homes, churches, and all households will find out the details of the directives that could be fined for after this vote. So much for working with the people who elected you all. As Tom Egan stated during your discussion of this at the 10/15/20 meeting that you all had last Thursday night, he asked, why are there financial consequences now? Why the hurry to pass this without knowing all the details? Why not take the time to meet with constituents and explain to them exactly what this ordinance means? It is my personal opinion, after watching and listening to all of you, most of you on the Board of Health have no idea what you had approved. I commend you, Tom
Conclude your remarks.
for the reasons stated above. You must be able to witness how much damage has been done to your constituents, because you surely heard it from hundreds of your constituents at previous meetings. The unemployment rate is up, schools in chaos due to changing ordinances, tax revenue.
If you could please work to conclude your remarks.
You are not following your mission statement. Your mission statement is to encourage cooperation among business, government, labor, and education to solve problems. I am pleading that you heed what I highlight or what your mission statement is and vote no on this, or at least table this until you can communicate with your constituents with what exactly this ordinance means. Thank you for your time.
Thank you, and thank you for your comments. Next speaker is Paula. If you could please state your name and address for the record, please.
Can you hear me?
Yes, we can hear you.
Okay, my name is Paula Gregerson, 4111 Fairview Road in Larson. I agree with what everybody said, so I'm not going to go into detail about the whole thing. I think I'm requesting you vote no to both 097 resolution and 1108. I don't see a need for it. It's not been there. And as everybody said, it was voted down by Palm, the exact same thing. And as those other ladies that are for this said, if it's already there, there's no need for you to vote on this locally. The point is, I disagree that it is there at the state level for you to enforce it. And there's no need to enforce it. The people don't want it. Vote against it. You're taking away people's freedoms, and there's no reason for it. And as they say, masks work, it's an uprising. I disagree with that. The hospitals are not overloaded with COVID patients. I've spoken with people who work at the hospitals. They're overloaded with other patients, not COVID patients. The numbers are inaccurate. And if you do your research, you would know the numbers are not accurate. People get sick. And so 1% have it. Oh, that 1% when it's your family. What about the 1% that are dying because of these type of things that are happening? Shutdowns, regulations, shutting down the schools. What about the more than 1% that are dying, suffering, and having complications from those? Those don't matter because it's not a part of the agenda. Thank you. Just vote it, please, away.
Thank you. Thank you for your comments. Next speaker is Jenna Schubert. If you could please state your name and address for the record, please.
Jenna Schubert, 29 Eveline Street, Oshkosh.
Thank you.
I did want to speak, first of all, to what some pro-1108 amendment folks had said. I really don't like that people are using the argument that because the public health director already has power at the state level, that it's okay that it's happening at the county level. This is terribly faulty logic. If it's wrong at the state level, it's also wrong at the county level. If it's wrong in Green Bay, it's wrong here. It's wrong, period. It doesn't matter that it's already passed somewhere else. It's not a good amendment for our county. What you guys have heard tonight, though, are very reasonable objections in this discussion, if this is a discussion. You've heard very reasonable reasons why this could prove disastrous for our community. I received an email this afternoon from a board member who compared the power of a police officer to that of what the health director's powers would be. And she said that basically the police officer and the health director would have similar power in the community. And the problem with this is that if my neighbors call the police department because they think I have a meth lab in my home, for example, the police would still have to go through proper channels. They would have to go through a judge. They would have to get a search warrant to come into my house. What is limiting the public health director in that way? What are her checks? What are his? What will their checks and balances be? I don't think a virus or even a health crisis should be able to trump our constitutional rights. I don't care what every other county in America or state has done. This is wrong. And since when is it the job of the county board, to protect the vulnerable and the weak? Isn't your job to protect our constitutional rights? Haven't you sworn to uphold the Constitution? I don't understand the connection here that's being made. It's not in the job description. So will the public health officer have to go through a judge? Will they have to get a search warrant? I mean, these are problems if the answer is no. The proposed amendment gives the health director authority even in merely suspected cases. This is very flimsy. This is a problem. So finally, what are the credentials for the public health officer? I feel like we should know this before going into this. This should be written up. So why are we in a rush to pass this? I think that it requires more time, more energy from the board, from the public, to come to some answers here. So if we think he will never have to use these powers, this is what most people are saying, why give them? Thank you, that's all.
Thank you. Thank you for your comments. Next speaker is Rebecca Longshine. If you could please state your name and address for the record, please.
My name is Rebecca Longshine, and I live at 132 West 25th Ave in Oshkosh.
Thank you.
I am speaking toward a couple of things. One is I don't think that we need to vote yes on extending or amending 1108 at the county level to match the state level. The state level is there for a reason and it takes care of things. If we have to, as a county, pay out the extra money that the state is saying we would have to, if they enforced it, then why don't we do that versus having to already pay out to enforce this ourselves? The other thing is I'm not on board with the hazard pay for county workers when there are so many people in our community that are struggling financially. And I'm not entirely sure about, I think it's 095, about the $11.5 million that you're looking to, it looks like, borrow for projects. And I would like some clarification on that when the time comes. And that is what I have. Thank you.
Thank you. And thank you for your comments. Next speaker is Marlena R. If you could please state your name and address for the record, please.
Hi, yes, can you hear me?
Yes, we can hear you.
Okay. My name is Marlena Ross, Armor, Wisconsin. Just want to thank you for your time. I had technical difficulties earlier when I did try to speak. I just want to start out by saying that by having the meetings on Zoom instead of in person, it's not allowing all the public to necessarily have a voice, especially those that aren't online or know that this is going on as they aren't online or have internet access, or like me, people having issues with connecting and being able to stay on the Zoom call and not being able to speak. I think that is not fair to those out in the community that would like to have a chance to say something and they can't. Also, I am confused and upset because I had some questions last week, Thursday at the meeting, and none of my questions were answered. So what I'm concerned about is when it says that in the ordinance that they can do other places, does that mean private properties like our homes? How will the health officer know or determine that someone is suspected of being infected? Is it based on medical records, on COVID-19 test results, or a family member, coworker, neighbor, friend, etc., who says they have it and came in contact with a suspected person? Also, nowhere in the ordinance is it mentioned about people who have medical exemptions, have been raped, have had trauma and or PTSD, and cannot wear the masks, and how this will affect them. Will they be fined for violating the ordinance? Will people who refuse to allow the health officer in their home be fined? We need more understanding of what this ordinance entails and how it will affect us as people, and how will it affect small businesses who are trying to accommodate everyone, including those who have medical exemptions and are limited to where they go. The virus is just that, a virus. It used to be when you went into the doctor's office and you had virus, they would send you home with no meds to rest and allow your body to naturally fight the virus. It is scary that the people in health positions who aren't even sure or know much about this virus are saying the list of symptoms include things as small as a runny nose, congestion, cough, flu symptoms, etc. It's fall, where we go out, where it gets colder outside, and people, including children and adults, get a runny nose. Is that to say that we have COVID? Or do we have a common cold? Are we going to quarantine people for colds, flu, allergies, etc.? We haven't in the past. What about the people who have serious medical issues and can't get the medical care they need because of COVID regulations, or because they're saying that the hospitals are overflooded and they can't get them in? I feel that there are many unanswered questions and open-ended things that leave it too wide and too broad of a scope to let us know exactly what this ordinance entails and what it allows the Winnebago County Health Department to be able to do. It is far too overreaching. Who is supposed to be in charge of our healthcare, us or the government? Who determines what is best for each individual, for our families, for our bodies? Each of us has our own uniqueness and differences. No one person is the same. We don't all get the same illnesses. We don't all have the same symptoms. We don't all respond to medications the same. What we put in our bodies and how we live is for us to decide, not the government. The government is there to protect our civil liberties, not to take them away. I'm asking also for you to vote down the resolution allowing the hazard pay for Winnebago County regular employees. I feel like there are more than just county workers that have been more frontline during this time, like grocery workers, gas station attendants, healthcare workers, etc. Is it fair to just give one group hazard pay when there are more groups that have been working just as hard and sometimes even harder in dealing with this time and the effects as much as the county workers? And that is all I have. So please vote against the ordinance and the hazard pay. Thank you.
Thank you. And thank you for your comments. Next speaker is Mike Braun. Please go
Greetings.
ahead. If you could state your name and address for the record, please.
My name is Mike Braun. I live at 1110 Honey Creek Road in the town of Algoma. I want to thank all of you for your patience in putting up with my lack of technological knowledge. I also appreciate you guys listening intently for the last hour and a half as you've been barraged. Earlier, a person said that the vocal majority isn't necessarily the majority, but in matters of voting, when individuals show up, their voice needs to count. I've counted 4 or 5 people in favor of this ordinance and over 25 in opposition to it. I'm hoping the board is listening, that they haven't already predetermined in their mind how they're going to vote. Doug Guerin, for those of you who don't know, our county health officer has a zoology degree and a biology degree. He has never treated one human patient. However, amazingly, he is allowed to have this position according to state statute. I am in opposition to number 9610-2020, the rewrite of 11.08, for a lot of the reasons that we've heard today. Even though the board would have to vote to approve the general order from the county health officer, he would still have the right to go in and, quote, quarantine and disinfect schools, public buildings, quote, other places. Well, I think everybody understands other places would be businesses, churches, and private residences. Secondly, this individual would be able to write tickets of up to $500 without due process. So we are subverting the district attorney's office and everything else and giving this person police powers. And I did not see any law enforcement coursework or any criminal justice coursework in Mr. Guerin's background. So we would be giving a non-elected appointed official police powers without him having any experience in that area. On top of that, no one would be able to interfere with his investigation. It's very scary. I asked one board member earlier today, does it not concern you that an unelected person that does not have the oversight, once the approval is given, would have that much power? And he never answered me. So my concern is that absolute power corrupts absolutely. And we need to be very careful with that one. On number 97, I'm also against it. My understanding is that raises have been given to prison workers and also frontline workers. They've also received bonuses from the county. And I think this is a redundancy, especially at the cost of $550,000 of taxpayer money. I think it's not that we don't appreciate them, but enough's enough. Thank you very much for your time. I really hope you guys have a great meeting tonight.
Thank you. Thank you for your comments. Next speaker is James. If you could please state your name and address for the record, please. It's the individual under the name James.
Hi, can you hear me?
Yes, if you could state your name and address for the record, please.
Sure. James Merton, 806 West Cecil Street in Neenah.
Thank you.
I'm going to do my, I really don't want to, there's been a lot of great points that have been made pertaining to the amendment at hand, ordinance 96-10-2020. I'm not going to reiterate anything. I think a lot of points have been made. The one thing is I would just say is that, well, I should say my opinion on that, which is that I'm obviously against this. There is a separation between, in my belief, this should not be treated as just a solution for COVID. This is a long-term, what's the right word here? This is something that would be written into the by ordinance for long-term, and it does not necessarily. I'm sorry, I can't do this. I just feel this is very problematic, and the fact that there isn't separation of powers with this, that you're giving, quite frankly, too many tools to one person for this. COVID, in my opinion, I think the issues that are pertaining to that are actually social issue, not a health issue. I mean, obviously the disease itself is a health issue, but the not refusing to wear masks and everything like that, it pertains to the having a mandate and people being, having the backlash with that. So I guess I just ask you to please consider not, or to vote this down. And I appreciate your time. Thanks.
Thank you, and thank you for your comment. Next speaker is Gretchen Schilder. If you could please state your name and address for the record, please.
Hi, yes, my name is Gretchen Schilder. My address is 5441 Raymore Road in Omro.
Thank you.
First of all, I'd like to thank you for allowing the community to be able to speak on some of these issues that are going to affect us greatly coming forward in the future. And I also do want to express the fact that the Zoom meetings are very much limiting the community participation. And I know for the Oshkosh Common Council meetings that they allow people to log in and even their board members to participate remotely if they are not comfortable being there, but they still have the meetings in person so that we as a community can come and we can participate, and that this isn't our only avenue. So I don't appreciate just having this on Zoom. So really, I would like to speak to this amendment to 1108 as well. I feel that this amount of power should never be given to an unelected official, much less an elected one. And I'm quite shocked that the Winnebago County Board would even consider this again after the vast amount of community opposition the last time this was brought up. We, the people, have the right to be able to run our own lives, our homes, our businesses, how we see fit without this type of interference from any governing body. I've read the wording that the Board of Health has approved, and it's ridiculous to even assume that one individual could have such power to use any means possible to contain a threat, or what's even more scary is a potential threat in regards to public health. What do you suppose that the government had put the mask mandate in place for? Well, now it's supposed that, it's supposed to protect us. There's obviously a lot of controversy about the masks as well, but I have 2 children that cannot wear masks medically. They've already been mask bullied about this. We've already had people, out in the community that have pointed that out and that have not taken into consideration their health needs. And so now, apparently every individual in society as a whole is a potential threat, because you're saying that we're all sick. And if we're all sick until proven healthy, how are you going to prove us healthy so that we can actually walk around? Are we going to go to the point where we have to put little gold stars like back in Hitler's day to make sure that we can actually be safe to walk around without fear of being cited because we're out in the community? It's just absolutely preposterous. If we trade liberty for safety, we will have neither. And I know a lot of people have brought that up. If the health department could give recommendations to let us know decisions on how best to live our lives, and then let us make that decision with that information in mind. Maybe if we're not handing out COVID tests like candy, and we're actually asking people if they would like to have an antibody test so that they know if they've already been infected by this virus, they don't have to live in fear of it.
If you could please work to conclude your remarks.
My last thing is to the former Oshkosh Health Department nurse that spoke. You are absolutely right. This is about enforcement for the health department. And this person has just shown that this is exactly what the health department wants. They want people to call out their neighbors so that they can hand out fines to people and businesses. I ask that you vote no on this.
Thank you. Thank you for your comments. Next speaker is the individual on the phone, Julie, or on the call, Julie. If you could state your name and address for the record, please.
Hi, can you hear me?
Yes, we can hear you well. Thank you.
Okay, yep. My name is Julie Cleaver and I live at 1633 Georgia Street in Oshkosh.
Thank you.
Yep. I just wanted to encourage you to vote no on this, basically for the same reasons that everybody else has said. I don't agree that a person in the health department who hasn't been elected is not an elected official should have that much power. And I believe it's complete overreach at any government level that our lives should be dictated by someone else when we have the constitutional right for the pursuit of liberty, happiness, a free life. And I think that this ordinance is a big overreach, and it could set a precedent that could be very dangerous in other cases and other situations. And I don't think that this is that I believe that the coronavirus is real and that COVID can affect a lot of people. And it has either like not killed them, but some people might have, but especially those with underlying circumstances. And I even personally know someone who is affected that much by it. But I do not agree that our choices and freedom should be taken away and should be under the rule or authority or power of a single person, one who doesn't have the knowledge or a degree or a health department or a health degree or medical degree or anything. And so I'm just encouraging you and asking you to vote no for the ordinance 9610/2020.
Thank you. Thank you for your comment. Next speaker is Linda. If you could please state your name and address for the record, please. If you could state your name and address for the record, please, Linda. Linda, if you could please state your name and address for the record, please. I'll ask one more time. Linda, your mic is open. If you could please state your name and address for the record, please. Okay, we're going to move on to the next individual. That would be Jason Kmechik. You could please state.
Hi, this is Jason Kmechik at 1019 Otter Ave, Oshkosh, Wisconsin. I can't believe I served my country to have to vote down garbage like this. Vote down, vote no for 96. Although I appreciate Winnebago County and everything that they've been doing, vote no for 97. That's all.
Thank you. Thank you for your comment. Next speaker is Lorenz Scherzer. You could please state your name and address for the record, please.
My name is Sarah Scherzer and the address is 204 Wildberry Lane in Oshkosh, Wisconsin.
Thank you.
I am definitely wanting to thank all of you. I really appreciate our elected officials, but unfortunately, this here amendment, and it's one of my biggest concerns, is having a local health officer dictate what we should do as a community. I do not believe that this is something that should be taken lightly, nor do I feel like this is something that should be voted on right as soon as we are done speaking tonight. I believe that this is something that we should be voting on as a county. And I've lived in Winnebago County for 44 years. And I do believe that this here is something that you should not take lightly. I know that several have stated that if these are on the books, then if this is already on the books, then why are we even taking a vote? I also believe that our government has already put in a 25% capacity on all of our businesses. And right now we are treating the businesses as being reckless. And I think that is very much unfair to them. So basically, I really want 1109 voted down. That is all that I have to say.
Thank you. Thank you for your comments. Next speaker is the individual under the name Nelson. If you could please state your name and address for the record, please.
Can you hear me?
Yes, we can hear you well.
Okay, perfect. My name's Hannah Nelson and I live at 1385 Mason Street, Oshkosh, Wisconsin.
Please go ahead.
I'm not going to say much because a lot of people have already said what I wanted to say. So I'm just echoing the to not pass 1108 and to not give the county workers the hazardous pay. So I'm just reiterating what everyone else has vocalized, and I agree with them that this shouldn't be passed.
Thank you. Thank you for your comments. Next speaker is Jason Brennenstuhl. I apologize if I mispronounce your name, sir. You could please state your name and address for the record, please.
Jason
I just-
Brennan.
Oh, please go ahead, sir.
Jason Brennenstiel, 526 East River Drive, Omro.
Thank you. Please go ahead.
Resident of Omro and also pastor of Wildwood Baptist Church there in Oshkosh. And I have a couple concerns in regards to the original report that was given to the board by the Wisconsin Association of Counties, I believe it's called. It referenced a few things that I'll bring out. The first thing was that any of these considerations also come very close to constitutional rights, the freedom of speech, freedom to gather, freedom of assembly, and great care should be given to realize that those rights are there, to realize that it is a possibility of restricting those things that Americans hold dear. And yet in the proposal that the Winnebago County wants to adopt, it does not seem like there is that care or that caution. When people have brought up these concerns, basically it's the nothing to see here approach, and I'm concerned about that. Also, the report gives very clear guidelines to say that any rule or an enforcement or guideline brought out by the public health official should be as narrow as possible, as surgical as possible, as it were, in order to show to the public that the health officer does regard constitutional liberty, does regard the freedom to gather. And yet I don't see any, maybe there is, but I don't see any reassurances that those are being taken into account or safeguards in place to say what will happen if those rights are infringed upon. I agree that the community is in a very difficult situation. I'm sure that COVID is real and that people are sick from it. And I, as a pastor, would be happy to meet with the county board and to come up with an amicable solution to how everyone can be best ministered to, whether it be physically or spiritually, but simply being told what is the method of our ministering, whether it be to 25 people or to 50 people, being restricted from just certain areas. I find it very, very concerning. And I want to help you guys do your job as long as we can do it together. I respectfully appreciate and admire your work, and I look forward to the time that we can work together for a good solution to this current crisis. Thank you.
Thank you. And thank you for your comments. And we have two other speakers. We're going to honor those speakers, and then we're going to conclude the public comments because we're just about at the 2-hour mark. So the next speaker is John Newman. Please go ahead. Now I see other people calling in, but I'm going to stick with the 2-hour mark. So I just want everyone to be on the same page. The last speaker in the public comments today will be Sarah Simon. Please go ahead, John Newman.
Thank you, Chairman. My name is John Newman. I'm at 1013 Washington Avenue.
Please go ahead. Thank you.
And I do appreciate the opportunity to call into kind of a virtual meeting. I see you have 300 participants and incredible feedback from the community and great thought ideas. But I do totally agree with the 300 people in one area would have been a concern if you run the math and 300 of us get together. Some of us do have COVID, and we would have just been kicking a skunk, in my opinion. And I do appreciate, the integrity and the dignity of the county health officer and the supervisors. And I really do have confidence in the numbers that are being promoted. I'm a healthcare worker. I've been a physician for 25 years. And this is my first pandemic, just like most of y'all. And I'm a little bit nervous because I look at all my colleagues on the participants. I don't know a whole lot of y'all. I would say COVID is definitely real. And the one thing over the last 7 months is, as healthcare providers, we have grown very confident in our ability to protect ourselves and to protect others from us by wearing masks, washing our hands, and keeping social distance. And I would say that while the topic of discussion tonight is as much compliance about what we can comply to mandate certain behaviors, I'm going to try and spend just 1 minute to try and get commitment, because I do think fundamentally as a community, we really should try and engage the community to fundamentally decrease the burden of this disease, and the hospitals on a typical day are 80% full from what we've been taking care of for the last couple of decades. But when you add 30 to 50 patients, the hospitals do get overwhelmed a little bit. I'm confident to say that we have not had to send people out of the community, and we've still been able to take care of the community, but it's a constant discussion of how the health systems within the community can flex to care for the community. And we're pushing some of their limits pretty close. I know the question came out about, how do I find out the testing? We're confident in our testing. We're confident in our ability to check our antibodies. The best way to check antibodies is go donate blood, because the blood bank still needs your blood, and they will give you kind of verification on whether or not you have been exposed to COVID-19. So
if you could please work to conclude your remarks, sir.
Thank you. It's just really commitment to the community to say, how can we care for each other by masking, by keeping social distancing? And thanks again for not bringing 300 of us together in one place. I appreciate it.
Thank you, and thank you for your comments. Next speaker is Sarah Simon. Sarah Simon will be our final public comment speaker this evening. Please go ahead, if you could state your name and address for the record, please. Sarah Simon? If you could please state your name and address for the record, please. Sarah Simon? Sarah Simon? Your mic is open. If you could please state your name and address for the record, please. Okay. Seeing, it looks like unfortunately Sarah's not able to open her mic. We are at the 2-hour mark, however, so I will hold to that. That will conclude our public comments. I certainly appreciate all the input from everyone, and I know the county board will take it into consideration. So we will move on to the next item on the agenda, which is correspondence. For that, I will call on Clerk Ertmer.
You have a couple of pieces of correspondence this evening. Excuse me, one of them is a thank you card to the Winnebago County Clerk and the Winnebago County Board. Thank you for all your thoughts and prayers and beautiful flowers. I'm finally home after 5 weeks and working my way back. I haven't lost my voice yet. I'm anxious to get back to normal. Get ready. Bob Warnke. Notices of claim. First one comes from Bruce Abraham for damage to his vehicle caused by road lines that had recently been painted by the County Highway Department on Leonard's Point Road. That's referred to the Personnel and Finance Committee. We have another claim from Andrew Crumroy for damage to his vehicle caused by an accident that occurred on August 7th, also referred to the Personnel and Finance Committee. We have a couple of resolutions from other counties. The first one comes from Brown County. It's a resolution requesting that the state Senate convene to address 13 water bills passed by the state assembly. That's referred to the legislative committee. And you have one more resolution from Outagamie County, and that is in regards to approving entering into an agreement with the Brown and Winnebago counties for solid waste disposal. And that is it.
Thank you, Clerk Ertmer. Moving on to the next item on the agenda is reports from any committees, commissions, and boards. If there's any county board supervisor who has any report from any commissions or boards, please go ahead and raise your Zoom hand. I'll call on you in succession. Any reports from any commissions or boards or committees from any county board members? If so, please raise your Zoom hand. Seeing none, we'll move on to the next item on the agenda, which is approval of the September 1st, 2020 special orders and September 15, 2020 business meetings for the county board. Is there a motion? For any county board member, they can raise their Zoom hand or say aye. Is there a motion to approve September 1st and September 15th business meeting proceedings? I see a motion and I see a second. Any discussion from any supervisor in regards to the preceding minutes from both of those? Just go ahead and raise your Zoom hand. Seeing none, we'll do a voice vote. All those in favor say aye. All those opposed say nay. And if at any time there's anyone who is a nay vote as a county board supervisor and I missed the vote, go ahead and raise your Zoom hand when I say nay. Seeing none, that motion carries. Moving on down, next is the county executives report. For that, I'll call on Executive Harris. Executive Harris? Please go ahead. Your mic's open. Yes, we can hear you.
Unmute for some reason.
Yes, thank you.
I wanted to tell the board that Parkview Nursing Home was named the best nursing home in Wisconsin by a major magazine. I believe it was US News, but it might have been Newsweek. But that's quite an honor to be named as the best nursing home in Wisconsin. Very pleased with that. With regard to the bond issue, you will get a report from Baird later on. But the $11.5 million of bonds sold for an exceptionally low interest rate. I'll let him disclose that, but it's the lowest interest rate we've ever had on a bond issue. And as you know, we went ahead with the full bonding and that the money we could have used to reduce the bonding because of the very low rates available now, we'll use that to call 2 other bond issues that are at a higher rate. With regard to hazard pay, I think it's controversial, but the county certainly has enough reserves to pay small hazard pay bonuses. A bonus is less problematic for the county than a raise because the raises are recurring and we're always crimped by the levy freeze. But one-time bonuses could come out of the general fund. It wouldn't pose an ongoing financial pressure on the county. And quite frankly, we expect the reserve to grow by a very substantial amount this year. The final thing is the enforcement powers. And I want to very briefly explain what I think. I don't think it'll change anybody's mind, but at least people have a chance to hear how this is laid out. The power given to a health officer is extremely broad. And I would have to agree with the people that the language is a little frightening. But that power was granted to the health officer by the state under state statutes. The county has no power to expand those powers or to limit them. That's from the state to health officers. They've been around for a very long time. And in fact, the Supreme Court case that's always cited in challenges to health officer power is Jacobson versus Massachusetts. And that's a 1905 US Supreme Court case, which an individual that had a small exposure to smallpox was charged a small fine for refusing to be vaccinated. And that's kind of the origin of these health officer powers. I think they've been in place in this state for many, many decades, perhaps more than a century. And state legislatures have never tried to modify these powers. And the language that nearly everybody cited that scared them was language right out of those state statutes. But here's the point of what we're working on tonight. And I hope you can all hear me. The state gave all these powers to the health officer, very broad. But some counties' codes, in fact, most counties' codes, did not specifically address those powers. And if it's not specifically addressed in the county's code, then there can't be enforcement. So we effectively have a health officer giving enormous powers by the state, but no ability to enforce any of those powers at the local level. And this didn't become apparent to us until there was an attempt to do an order after the Palm case. That's when we first became aware of it. People raised a number of issues that are worth at least addressing very quickly. One was, some people mentioned frustration with having spoken about this multiple times. This is actually the first time that it's on our agenda for a vote. This is the very first time. People that spoke multiple times spoke on this issue at meetings where it was not on the agenda. And that's why the board was in no position to respond to them, because we're only allowed to respond to agenda items. So that's why people spoke on this more than once, is that they chose to speak at other meetings where it was not on the agenda. And this is the first time it's on the agenda for a vote. One item that's brought up a whole lot is an issue of home invasion. And that's a serious issue, but it has always required permission of the occupant or an inspection order. And that inspection order has to be obtained from a judge. So that's the same as the warrants required by police to enter a personal residence. And that's in that language. Somehow, many people are reading this and somehow missing that requirement for a warrant that's been there all along. I don't want to belabor this. I'm sure the board will talk about this at length. But what's before us is whether our code will allow any of those powers given by the state to be enforced. And in fact, this proposal proposes curtailing that power in many ways by requiring a vote of a majority of the board. And that was an issue that was raised several times about an unelected official having powers. And again, I didn't choose who got those powers. Those powers were granted by the state and granted decades ago. We now need the ability to enforce them if they're going to mean anything. And we're actually putting in limitations, some of which were kind of inspired by comments from the public when we listened to them before. But those are my comments tonight. I also have an appointment tonight if there's no questions.
Are there any questions from any county board members? Please proceed with the appointments.
Okay. The appointment is to the Winnebago County Land Records Council, and subject to the board's approval, I have the following appointments. The Register of Deeds is always one of the appointments. It's Natalie Strohmeyer, Jerry Bougie, who's the County Land Information Officer, Bob Keller on the county board, Mary Kruger, who's the treasurer, Linda Coleman, who's the Emergency Management Director, Paul Schmidt, who's an at-large representative, Liz Nichols, who's the tax lister, Jim Smith, who's a registered land surveyor, and Mark Zugi, who's with East Central RPC.
Those are the appointments. Is there a motion for approval? I see Supervisor Lenz wish a motion to approve and Supervisor Norton for a second. Any discussion in regards to the county executive appointments? Please go ahead and raise your Zoom hand. Supervisor Lenz, anything further?
One quick question. I'm not exactly sure how it works, but if one of these individuals is up for re-election and they do not win their re-election, how does this process work if we appoint them to a position?
Sure. Several of these people are elected people, and if they don't win their next term, the person who wins that seat would take that seat presumably. I think I would have to come back to you though for the board approval of that. But you would normally have people in these offices that relate to land records on this council.
Okay, I guess I would like to know for sure that if I appoint person A, that we will have another chance to review if person B replaces them after the election.
Well, if you notice, it has their name and their title.
Okay.
And when the title changes, if they're listed as both their name and the title, when they no longer have that title, one would presume that their position on that committee would change. And that would be my intent.
Thank you. Appreciate it.
Thank you. Seeing no other questions, we'll do a voice vote for the appointments to the Winnebago County Land Records Council. All those in favor say aye.
Aye.
Any opposed say nay. Motion carries. Moving on down to the next item, and that's County Board Chairman's report. First, Supervisors Warnke and Super. All right, thank you. All right, very good. I don't need to make that announcement anymore. I do want to give some updates in regards to the budget session. We are now at that time of the year in which we consider the county budget. So that will actually occur starting next week. The first day will be next week, Monday, starting at 6 p.m. We have several departments that we will review that evening, and those are on an agenda that you all should have received or will receive very shortly. And you will also receive, and I believe you already have received, the agenda for Tuesday. The plan is we would continue with departmental reviews on Tuesday morning, the 27th at 8:30, continue through the day until we finalize all the reviews for the departments as of the end of the day on Tuesday. Assuming that is the case, then we would take up amendments to the budget and the adoption of the budget starting at 4 p.m. on Wednesday, the 28th. What we'd ask for county supervisors is that all of them, if they have an amendment, please provide them as soon as possible, but no later than 10 a.m. in the morning on Wednesday, October 28th. That gives the opportunity for the finance department to review them and make sure that the numbers may need to be reconciled are addressed, and that those amendments actually can be distributed to all county board supervisors and the public as of 2 p.m. on that Wednesday as well, October 28th, so that there's enough time prior to the 4 p.m. meeting that evening. Of course, the agenda can change depending on whether or not we would be able to conclude those departmental budget reviews as of Tuesday afternoon. Historically, that would be the case, but we will adjust accordingly if we are unable to do so. And then I just did want to make one comment in regards to access to these meetings. And what I would tell you is I recognize it's not perfect. This is challenging, frankly, for me as well. It's very challenging to run meetings like this. But I guess the one thing I would point out is that we actually had 301 individuals on this call this evening. I've been in local government for about 17 years now in the city of Appleton, the city of Neenah, and Winnebago County. And I'm not sure I've ever had 300 individuals at either a city council or a county board meeting, because unfortunately the physical structure just does not allow for it. So I can appreciate that this is a difficult forum, but this is actually the largest access that I'm at least aware of that I have ever been on in the hundreds of city council and county board meetings I have been on over the last 17 years. This is something I take very seriously. And I agree, it's not optimal, but these are not optimal times. And so what I would say is, I think everyone's just doing the best they can with what they have. And we're certainly doing what we feel we can to maintain that access for you all. And with that, we have a couple county board chairpersons appointments. So the first one this evening is supervisor in District 27. This is the vacancy of Jim Weiss, who retired from the board August 7th because he moved out of the district. The recommended appointment is Morris B. Cox from 2150 Deer Prairie Drive in Nita. I would ask for a county supervisor if there is a motion for approval.
I move to approve Morris Cox to the board.
I see a motion and I do see a second. Is there any discussion from any county board supervisor? I will lower all hands and now say, is there any discussion or comments from any county board supervisor? Seeing none, we'll do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries. So officially, Morris B. Cox is county supervisor in District 27. Mr. Supervisor Cox, I'd ask you to please stand so that we can read you and that you can complete the oath of office. If you could raise your right hand and repeat after me. I, Morris J. Cox.
I, Morris J. Cox,
Having been appointed to the office of County Board Supervisor,
having been appointed to the office of County Board Supervisor,
District 27,
Nussbaum is in here.
District 27,
swear that I will support the Constitution
swear that I will support the Constitution
of the United States
of the United States
and the Constitution of the State of Wisconsin,
and the Constitution of the State of Wisconsin,
and will faithfully and impartially discharge the duties
and will faithfully and impartially discharge the duties
of said office to the best of my ability.
of said office to the best of my ability.
So help me God.
So help me God.
Congratulations, Supervisor Cox.
Thank you, sir.
Very much look forward to working with you in the future. Thank you again. We have one other appointment this evening. It's an appointment to the Information Systems Committee, and it's Patrick Brennan, 229 North 9th Avenue, Winneconne. Is there a motion for approval?
I'll make a motion.
There's a motion and a second to approve. Any discussion in regards to the appointment to the Information Systems Committee? Seeing none, we'll do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries unanimously. So moving on down to the next item, and that is zoning reports and ordinances. We have a number of them this evening. The first one is report number 001, Carol Lanzarotti, Jeffrey Miller, and Lynn A. Miller, Town of Wolf River. For that, I will call on Supervisor Joas.
Thank you, Mr. Chairman. I move for approval of report number 001.
Second.
There's a motion and a second to approve report number 001. Any discussion? If so, a supervisor, please raise their Zoom hand. Seeing none, we'll do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. Motion carries. Moving on down to the next item. Mandatory ordinance number 100120. Rezoning from A2 general agriculture to R1 rural residential for tax parcel number 032-0184-02. 032-0184-03. Once again, call on Supervisor Joas.
Thank you. I move for approval of a mandatory ordinance number 100120.
There's a motion. Is there a second? There's a motion and a second to approve a mandatory ordinance number 100-2020. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye.
Aye.
Any opposed? Say nay.
Nay.
With one nay vote, that motion carries. Moving on down to the next item. That's report number 002, Judith Domer, Town of Black Wolf. For that, I will call on Supervisor Keller.
Thank you, Mr. Chairman. I move for approval report number 002.
Second.
There's a motion and there's a second to approve report number 002. Is there any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye.
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 Any opposed, say nay. That motion carries unanimously. Moving on down to the next item, that's a mandatory ordinance number 10220, rezoning R1 rural residential to R3 suburban medium density residential. Tax parcel number 004-0039-03. Once again, call on Supervisor Keller.
Thank you, Mr. Chairman. I move for approval of mandatory ordinance number 100220.
Second.
The motion is second to approve a mandatory ordinance number 100220. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries unanimously. Moving on to the next item, that's report number 003, Judith and Robert Felberg, Town of Winnebago. For that, I'll call on Supervisor Snyder.
Thank you, Mr. Chairman. I move to the adoption of report number 003.
There's a motion and a second to approve report number 003. Any discussion? If so, any supervisor can raise their Zoom hand. Seeing none, we'll again do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries unanimously. Moving on down to the next item, that's mandatory ordinance number 100320. Rezoning from R1A2 rural residential / general agriculture to A2 general agriculture for tax parcel number 030-0337-01. Once again, call on Supervisor Snyder.
Thank you, Mr. Chairman. I move for the adoption of a mandatory ordinance numbers 100320.
Is there a second?
Second.
There's a motion and a second to approve a mandatory ordinance number 100320. Is there any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries unanimously. Moving on down to the next item, that's report number 004, Kamai B. Maida Trust and Brent H. Walker Trust, Town of Oshkosh. Then I'll call on Supervisor Gabbard.
I move for the approval of report number 004.
Second.
Motion and a second to approve report number 004. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. Hearing no nays, that motion carries unanimously. Moving on to the next item, it's a mandatory ordinance number 100420. Rezoning R2 suburban low density residential to A2 general agriculture. Tax parcel number 018-0551. Once again, call on Supervisor Gabbard.
I move for the approval of a mandatory ordinance 100420.
Second.
There's a motion and a second to approve a mandatory ordinance number 100420. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye. Any opposed, say nay. That motion carries unanimously. Moving on down to the next item. It's a mandatory ordinance number 100520. Balin Incorporated, Town of Oshkosh, rezoning B3 General Business District to M1 Light Industrial District. Tax parcel numbers 018-0112-01 and 018-0112-02. Then I'll once again call on Supervisor Gabbard.
I move for the approval of a mandatory ordinance 100520.
Second.
There is a motion and a second to approve mandatory ordinance 100520. Any discussion from any county board supervisor? Seeing none, we did have a motion and a second. We'll do a voice vote. All those in favor say aye.
Aye.
Aye. Oh. Any opposed, say nay. That motion then carries unanimously. Moving on down to the next item. That's a mandatory ordinance 100620. Michael Yost and Penny Brazy, Town of Clayton, rezoning from R1 Rural Residential District to A2 General Agricultural District for tax parcel number 006-0793. That I'll call on Supervisor Fari. Supervisor Fari?
Can you hear me, Mr. Chairman?
Yes, we can.
Okay, I move for approval of resolution number 100620 with a correction.
Please go ahead.
If you'll note on the front page, this is being rezoned from R1 to A2. If you go to the back page, the above described property is hereby rezoned from, do you see that? Towards the bottom? They have them inverted. They go up from A2 to R1.
Very good. So, with that correction, there was a motion. Was there a second? There was a motion and a second to approve a mandatory ordinance number 100620. Any discussion? Seeing none, we'll once again do a voice vote. All those in favor say aye.
Aye.
Aye. Any opposed, say nay. It carries unanimously. Moving on down to the next item. That's a mandatory ordinance 100720. Carl Rasmussen, Town of Clayton, rezoning from A2 General Agricultural District to R1 Rural Residential District for tax parcel number 006-0243. For that, I'll call on Supervisor Joas.
Thank you, Mr. Chairman. I move for adoption of a mandatory ordinance 100720.
Second.
There was a motion and a second to approve a mandatory ordinance 100720. Any discussion? If so, any supervisor can raise their Zoom hand. Seeing none, there was a motion and a second, so we'll do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries. Moving on down to the next item. That's a mandatory ordinance number 100820. Robert and Janice Schomer, Town of Clayton, rezoning from R1 Rural Residential District to A2 General Agricultural District for tax parcel number 006-0664-01. For that, I will call on Supervisor Youngquist.
Thank you, Mr. Chairman. I move for approval of mandatory ordinance 100820.
Second.
A motion and a second to approve a mandatory ordinance number 100820. Any discussion? Seeing none, we'll once again.
Chairman.
I see Supervisor Fari. Please go ahead.
Thank you, Mr. Chairman. I raise a note to the same correction. Front page reads from R1 to A2. The back page contradicts that. It should be R1 to A2. It reads A2 to R1.
Very good. Yes, see that. Thank you. With that correction, there was a motion. Was there a second?
Second.
A motion and a second to approve a mandatory ordinance 100820. Any discussion? Seeing none, we'll do a voice vote. All those in favor say aye.
Aye.
Aye. Any opposed, say nay. That motion carries unanimously. So that concludes zoning reports and ordinances. So we'll move on to the resolutions and ordinances section. The first one is resolution number 090-20 2020. Commendation for Barbara Sheldon. For that, I will call on Supervisor Rasmussen.
Thank you, Mr. Chairman. I move for resolution 090-10-2020.
Second. There's a motion and a second. Please go ahead, Supervisor Rasmussen.
In September 1983, Barb Sheldon began working on a contract basis as a registered dietitian with the Winnebago County Public Health Agency. She became a regular employee as the WIC Program Director Nutritionist in January of 1984. Barb remained with WIC, which is Women, Infants, and Children, Program Director for over 36 years. Due to her consistent high performance and outstanding professionalism, she has been recognized as a statewide leader in WIC programming. Barb ran a great WIC team and ensured a good customer experience for her clients. Barb retired on October 5th, 2020. Please join me in recognizing her for her outstanding service.
Thank you, Supervisor Rasmussen. There was a motion and a second to approve resolution number 090-1020, commendation for Barbara Sheldon. We will do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries unanimously. Moving on down to the next item, that's resolution number 091-10-2020, commendation for Patty Strasser. For that, I will once again call on Supervisor Rasmussen.
Thank you. I move for resolution 091-10-2020.
Second.
There was a motion and a second to approve resolution number 091-10-2020. Please go ahead, Supervisor Rasmussen.
Patty Strasser began her 26-year career with Winnebago County on June 24th, 1994. Over the years, she gained a vast amount of knowledge about the county, working in the Sheriff's Department, Clerk of Courts, and ending her career in child support. She strove for excellence and continued her learning by working in multiple areas, including financial and enforcement. Patty demonstrated her compassion and dedication to the child support program, participants, and coworkers with a positive team-based attitude. She was willing to help out any client or coworker when approached, regardless of if it was something on her caseload or not. Patty's commitment and dedication to the families and employees of Winnebago County was clear through her long-term career and will be missed. We are grateful for Patty's 26 years of service and wish her the best in her retirement.
Thank you, Supervisor Rasmussen. So there was a motion and a second to approve resolution number 091-10-2020, commendation for Patty Strasser. We'll once again do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries unanimously. Moving on down to the next resolution. Resolution number 092-10-2020. Commendation for Pam Weber. Once again, call on Supervisor Rasmussen.
Thank you. I move for resolution 092-10-2020.
There's a motion. Is there a second? There's a motion and a second. Please go ahead, Supervisor Rasmussen.
Pamela Weber retired on September 11th, 2020, after over 40 years with Winnebago County. Pam started with the agency on August 5th, 1980. She worked for social services and then human services in the child welfare division as a social worker her entire career. Pam retired as a social work specialist, youth justice. During her career, Pam worked in the NENA office, serving youth who are involved with the courts due to delinquency offenses and their families. Throughout her time with Winnebago County, Pam's focus has remained on the importance of supporting youth and their families and gathering with them to make positive changes. She will be greatly missed. Thank you.
Thank you, Supervisor Rasmussen. So there was a motion and a second to approve resolution number 092-10-20, accommodation for Pam Weber. Once again, do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries unanimously. Moving on to the fourth resolution. Resolution number 093-10-2020. Disallow claim of We Energy from August 12th, 2019. For that, I'll once again call on Supervisor Rasmussen.
Thank you, Mr. Chairman. I move for resolution 093-10-2020.
There's a motion and a Second? Is there?
Second.
There's a motion and a second to approve resolution number 093-10-2020 to disallow the claim of Green Energies from August 12, 2019. Is there any county supervisor with any discussion? If so, just go ahead and raise your hand. Seeing none, we'll once again do a voice vote. All those in favor say aye.
Aye.
Any opposed, say nay. That motion carries unanimously. So moving on down to the next resolution. It's resolution number 094-10-2020. Request authority to apply to the Department of Natural Resources for funds to reestablish sections of stream bank, Wacaw Creek Dam facility, and to commit such funds as may be made available to a restoration project. For that, I'll call on Supervisor Konetsky. Supervisor Konetsky? I'll then call on Supervisor Norton.
I'll move option of 093-10-2020.
But then you're done with the whole meeting.
There's a motion for resolution number 094-10-2020. Is there a second?
Second.
There's a second, so there's a motion and a second to approve resolution number 094-10-2020. I'll open it up for any discussion from any county board supervisor.
Put there
If
and
so,
just.
please go ahead and raise your Zoom hand. I'll first call on Supervisor Gordon.
Thank you, Mr. Chairman. I just wanted to make a note that there's 5 people with their mics open. So on my computer, I'm getting a lot of feedback from that. If you could ask everyone to close their mics unless they're speaking.
Yes, thank you. Yes, any supervisor, when you're not speaking, please go ahead and close your mic, open it up whenever you're speaking or whenever we're doing a vote. So thank you, Supervisor Gordon. Anything further?
Thank you.
Thank you very much. Any other discussion on resolution number 094-10-2020? Seeing none, we'll do a voice vote. All those in favor say aye.
Aye.
Aye. Any opposed, say nay. That motion carries unanimously. Moving on down to the next item, that's resolution number 095-10-2020, awarding the sale of 11,500,000 general obligation promissory notes. For that, I will call on Supervisor Rasmussen.
Thank you, Mr. Chairman. I move for resolution 095-10-2020.
Second.
There's a motion and a second. Anything further, Supervisor Rasmussen?
Yes,
Please.
I know Mr. Harris talked about some of this, but the bond sale took place this morning and the final interest rate came in at 1.15%, which is 900s better than the anticipated rate of 1.24 that we presented last month. Last year, the borrowing rate was 2.0. This is the lowest rate Winnebago County has ever received for a 10-year borrowing. As a reminder, and also I know there was one question asked during public comments about this, we chose to borrow this year due to the historically low interest rates. We plan to use excess undesignated general fund balance to pay off older callable debt that is at interest rates of 2 to 2.5%. We also plan to apply a portion of the undesignated general fund balance to future capital projects versus bonding for them when rates will probably go up. Chairman Ramos, if you could please allow Justin Fisher from Baird to share his screen to present to the board the results of today's bond sale. Thanks.
Thank you. Please go ahead, Mr. Fisher.
Thank you, Mr. Chairman. Let me see if this works. I don't believe I have the ability to share my screen. It's saying host disabled participant screen sharing.
Do,
Oh, there we go. That's not mine.
we're working on this end here.
It's on. It's on our screens.
You can see my presentation?
I believe we see Sue's email.
Still working it on this end.
Okay.
Now, Mr. Fisher, you should be able to share your screen.
Yes, that just, let's see here. Does everyone see the presentation?
Yes, we can see it well.
Perfect. Well, as already stated, unbelievable interest rate that was received today by the county, historic low that the county has ever received. The prior low was a 1.48%. That was the second lowest. This is a 1.15%. So advantage of the historically low interest rate environment. A lot of counties, communities across the country are doing the same thing. In the bond market alone, these next 2 weeks prior to the presidential election, there's going to be about $25 billion in municipal bonds. So, you know, you're getting in at the right time as the supply is starting to really ramp up over the next week or so. So when looking at the issue summary, this is a general obligation promissory notes in the amount of $11,500,000. It will be closing April 10th of 2020. The maturities will range from April 1, 2020 to 2030. So a 10-year financing. The first interest payment will be next year, April 1, 2021, April 1 of 2027. Moody's did affirm the rating for the county at a AA1. And I know it is a goal of the county to get to the highest bond rating possible, which is a AAA. So right now the county's one notch below the AAA rating. There's only a handful of counties in the state of Wisconsin that have the AAA rating. And when we talked to the Moody's analyst about what the county can do to get to that AAA rating, he really had us focus on the fund balance reserves and being really cognizant of how that's being used in the future. So something that we're going to be definitely thinking through as we continue to look to next year and how to use that that fund balance for future capital projects or use it to pay off debt or reduce future borrowing. So all things that we're going to be looking at. The true interest rate is a 1.15%. And This page is, there's a lot of numbers on the page, but essentially from what I showed you last time to this time, because of the lower interest rate than what we originally projected, the interest cost savings with the rate is about $50,000. So good news there. Also, we were able to hit the target of reducing the debt service mill rate by 3 cents from 65 cents down to 62 cents. This also factors in the future 5-year capital improvement plan borrowings. So that's going to change year over year. Every time we go to look at those numbers change, but this at least gives us an idea of what potentially the numbers may look like into the future. The last few pages is the Moody's rating report. It really just highlights why the county received the AA1 rating. Some of the main points it addresses within this report is it really notes the strong management of the county. So I want to, give a kudos to the county board for making sure that the county is doing so well financially. Notes the low debt that the county has compared to other counties that are in Wisconsin. And then it also talks about the strong reserve that the county has. So all things that are important. And when I mentioned that, it is a goal of the county to receive A in the future, what does that mean for savings to the county? And when you think about a $10 million borrowing, that's about anywhere between $60,000 to $90,000 in savings, interest cost savings every year by getting the higher bond rating, which ultimately results in lower interest rates. So some things to definitely think about for the future, but extremely good news for the county today.
Thank you, Mr. Fisher. Any questions from any county board members? We're going to go ahead and work to change the screen now. So if you could just give us 30 seconds to a minute to adjust, and then we'll be back. There was a motion, I'm going to say it again. There was a motion and a second to approve resolution number 095-10-2020, awarding the sale of 11,500,000 general obligation promissory notes. Is there any other discussion? Seeing none, we'll do a voice vote. All those in favor say aye.
Aye. Aye.
Any opposed, say nay. That motion carries unanimously. So the next item on the agenda is amendment number 096-10-2020. For that, I am going to go ahead and relinquish the chair to our vice chairperson, Tom Egan, so that I can introduce this amended ordinance and offer up the amendment I referred to earlier. So from now going forward, Vice Chairperson Egan is the chair. If you could just give us about 30 seconds to a minute to adjust.
Okay, thank you, Chairman Ramos. For this here, we'll go to ordinance number 096-102020, amendment section 11.08 of the General Code of Winnebago County Health Officer. And at this time, we'll call on Chairman Ramos to introduce it.
Thank you, Vice Chairperson Egan. I will move approval for amended ordinance number 096-102020, amend section 11.08 of the General Code of Winnebago County Health Officer. And then I will offer up an amendment if there's a second.
Do I hear a second?
Second.
Second.
And it's seconded.
Thank you, Vice Chairperson Egan.
Chairman Ramos.
Thank you. Thank you, Vice Chairperson Egan. So I want to offer up an amendment as I mentioned earlier in the session. So I want to amend line 81, which is the definition of general order. Line 81 ends with the word general order. I want to amend it to add one additional sentence after that to say any general health order under this ordinance must not include a general workplace shutdown.
Is there a second to that?
Second.
Do I hear?
I second that.
Oh, motion's made and seconded to the amendment. Now, all we'll be discussing at this time will just be the amendment part of it. Do we have any discussion on the amendment?
Chairman Ramos, could you please repeat the last part of that sentence?
Yes. So this is an additional line on page 2, line 81. So it would be a sentence after the other sentence that ends at general order, period. It would add the line saying any general health order under this ordinance must not include a general workplace shutdown.
Is there any discussion at this time on the amendment? If there is, just call in. Any discussion? I'm going to have our tech person also check to make sure. Supervisor Lenz?
Thank you, Acting Chair Egan. Just a question, we're doing that amendment to the definition for the general ordinance. Is there a reason we wouldn't be extending that also to the individual ordinance definition?
Is that a question for me, Supervisor Lenz?
That would be directed to you, Chairman Ramos.
Okay. So over the last 4 months, frankly, because this actually goes back to June, one of the comments I've heard from a number of individuals, in particular, again, over the last week, was about concern about a possibility of a general order referring to a shutdown of business in our community. I told them that for me personally, that certainly was never my intent in the first place. Moreover, this ordinance, remember, is advisory only. And I had to admit to myself that if there was a general order in this county to shut down all general workplaces, that would be advisory only, and then it would come back to the county board. And I'm a county board member too, and I would have to decide whether I was comfortable voting for that. And admittedly, I would struggle with that one. I think for a general workplace shutdown, I do think that would come better at both either a state or national level. So once again, I heard that comment from multiple individuals over the last 4 months. I heard it in particular over the last week and a half. And honestly, that was public input. I recognized it. And so I'm acknowledging it here and offering that up as an adjustment to this.
Supervisor
Tom
Fari?
Egan, Tom Egan, could you mute yourself when he's talking, please?
If I do, then you're not going to hear me next, so.
No, I mean, when he's talking, just mute yourself.
Did I answer your question, Supervisor Lenz?
Actually, you answered why you did it for the general. I was curious to why, if this is the right spot for that amendment. To find that out, I was wondering why this was also not referenced in the individual order definition.
Okay, certainly. So once again, that's what I've heard from the public, but from myself personally, we have codes in a number of areas in regards to sanitation. And while we never want to go that line, and it rarely happens, frankly, I think very few of us can think of an establishment where an actual order because of sanitation shut down a business. But there are mechanisms in our code to provide for that. Well, I would hope that it would never come for one individual business in that case, because of course we would expect our health department to work with them, to counsel with them, to give them opportunity to change and correct whatever the situation would be with the communicable disease. But if there was one individual business where there was a communicable disease issue that unfortunately the issue was not resolved or someone was opposed to resolving it, then you have to have some sort of mechanism in place for that rare exception. And remember, that's rare because after all, we can do that for sanitation right now for restaurants and bars. And I think you all know we don't take that lightly, and it happens very infrequently. But to say it never could happen would be difficult to say. So that's my honest answer in regards to that one.
Thank you, Chairman Ramos.
Thank you.
Supervisor Fari?
Mr. Chairman, can you hear me?
Yes, I can.
Okay. Chairman Ramos, I'll read this, your quote. Any general health order under this ordinance must not include, is that your word, must?
Yes, that's correct.
Shouldn't that word be shall?
I am certainly open for more whatever word best conveys the sentence that a general order would not be allowed to have a general workplace ordinance. So if it's deemed that shall is a better wording, I have no issue with that whatsoever.
I would certainly think that would be more definitive. So would you offer that change?
Certainly. So let me, so I will withdraw it if it's okay with the second.
Yeah.
Then I will offer up the amendment again. So it would be on line 81. And it should read, any general health order under this ordinance shall not include a general workplace shutdown.
Thank you.
I second that.
Supervisor Gabbard?
I appreciate your amendment to this amended ordinance. That helps me somewhat on determining my vote tonight. But what worries me about this is that's not enough for me yet for the enforcement side of this, but I do appreciate your amendment to this 1108. Thank you.
Is there anybody else? Supervisor Norton?
Thank you, Mr. Chairman. Am I understanding this? I think I understand it correctly. This amendment says the health officer can't just shut down all business of a certain type, but yet he could issue an order, a capacity order saying you can only operate 25% of that. Is that how I understand that?
Yes, this amendment doesn't say anything in regard to percentages. It simply says that it's clear that there could not be a general workplace shutdown in a general order.
Anyone else have any? Supervisor Bender?
So if I understand it correctly, you could take a business and he could order them to only operate at 50%. Is that correct?
Can you hear me okay?
I can hear you.
Under this amendment, it wouldn't relate to that at all. Could there be a general order that he advisory only could put forward based on what you're asking? Yes, but it could never be mandatory unless this board approved it. It would remain advisory only.
Thanks.
Any other questions on the amendment? Any other questions on the amendment? This is just the amendment now we're talking about. Last time, any other questions from the supervisors on the amendment? Not hearing any else on the amendment, I am going to turn it over to Chairman Rams to take over the meeting.
Thank you very much, Vice Chairperson Egan. I appreciate that. And now I will just work to make sure that I have the host function. So if you could please give us 30 seconds to adjust for that. As you can understand, we're working virtually here, so we can't simply swap chairs physically. So we have to swap virtually. So if you'll give us 30 seconds to do that. So we are back on the main amended ordinance as amended here this evening. So we'll open it up for discussion for any supervisor.
Can I talk? Chairman Ramos?
So before we do that, of course, we need to vote on that amendment. Okay? So we're going to attempt to do a voice vote, but if it fails, if we can't be certain, then we will go to a roll call vote like we've done in the past. Okay? So all those in favor of the amendment to add the one line on line 81, say aye.
Aye. Aye.
Opposed, say nay. I heard no nay votes. If there are any nay votes from the board, just to verify, could you please raise your Zoom hand? I didn't hear any nay votes. Okay, so that amendment to add that one line on line 81 is passed. So that line would now have the verbiage, any general health order under this ordinance shall not include a general workplace shutdown. So we are now on the main amended ordinance with that additional amendment. So we will open it up for discussion from any county board supervisor. So first I will call on Supervisor Norton. Please go ahead, Supervisor Norton.
Thank you, Mr. Chairman. I would like to kind of go back to what the county secretary was talking about when you presented it or talked about it. Does the health officer, if he has to go to help investigate, does he have to get a court order to go in and investigate and do whatever to stop this epidemic or whatever kind of things that the county executive was talking about? And I don't know the answer to that, but I'd like that answer about, does the health officer have to get a court order to do those activities?
I will call on our Corporation Counsel to answer that question. Corporation Counsel, Mary Ann Miller.
Yes, Chairman Ramos. Supervisor Norton, the state statute is clear. And just to basically recodify what people have been saying all along, this amended ordinance is attempting to create an enforcement mechanism. It is not creating any new powers for the local health officer. In terms of your question, Supervisor Norton, regarding investigation and reporting, under the state statute, the local health officer may obtain special inspection warrants, except he does not need to obtain them in cases of emergency. So in that regard, under 66.0119, he has every right to obtain those warrants. What is critical in this whole situation is that what he has to do, basically, Doug Guerin, local health officers, are vested with power to issue orders, and I want to emphasize this, that are reasonable and that are based on local conditions, and that the local health officer deems necessary to curtail the spread of a communicable disease. And I can tell you, so in that regard, it is the state statute that is basically authorizing him to do this. But again, he has to be guided by reasonableness and looking at the local conditions. That is clear.
Did that answer your question, Supervisor Norton?
Yes, right, yes.
Any further comments, Supervisor Norton?
No, not this time. Thank you.
Thank you, Supervisor Norton. Next speaker is Supervisor Nussbaum.
Thank you. Do you remember the Patriot Act? Do you remember how the news media and the government used the 911 crisis to take away our rights and liberties? Do you remember that? Well, I was one of the useful idiots that cheerfully accepted that. And then about 8 or 9 years later, the Lord led me to look into the truth about 911. That's when I discovered that the government and the news media uses fear in order to control us and take away our rights. I think it's best to trust in God, not the government, especially when they're trying to take our rights away. Thank you, Mr. Chairman.
You're muted, Mr. Chair.
Thank you, Supervisor Defferting. You were absolutely correct on that one. Please go ahead, Supervisor Shorsey.
Oh, okay, you were talking to me. Thank you, Mr. Chairman. First of all, I'd like to say that I do wear a mask. I do physically distance, and I wash my hands and use hand sanitizer. And I was also quarantined at home as a child with scarlet fever. So, and have worked in healthcare. But my vote tonight will be no this evening for the following reasons. And I am taking a little different perspective. Some of the points have been made by others, but these are my reasons. So first of all, imagine having an agreed upon community plan for moving forward in this COVID environment. A plan that was adopted by key leaders from all sectors with a robust education and communications program to support community guidelines. Instead, we, county leaders, waited for months for direction from other sources beyond the good administration that the public health people have been doing for months now. Hence, we've had no clear local leadership to date. After watching, researching, and listening these past months, I've decided that we should not provide more powers since we have never used the power we already have to impact local behavior around COVID-19. Furthermore, because of this mismanagement, what I perceive as mismanagement, I do not trust intentions or integrity of the process we've experienced. I do support a significant county role, but just not this one. Legislative powers are already outlined in Wisconsin Chapter 252 for communicable diseases for both state and county health officers. There are broad powers governing what we have been fighting over since March. Plus, we have been preparing for pandemics for 15 to 20 years at the local and state level. Why have none of these plans been presented? This leads me to think that the state and legislative leaders have been asleep at the wheel while others were busy preparing for what we knew was inevitable. We've known this for many, many years, that something like this was going to come along. Now it's a mad scramble, further complicated by those who have decided to politicize the situation or just not lead. I prefer community cooperation versus enforcement beyond what is already allowed. So that the bottom line for me is, if we have not used the authority and tools we already have, why would we ask for more? There is no need, and that's why I'm voting no.
Thank you, Supervisor Shorsey. Next speaker is Supervisor Defferding. Please go ahead, Supervisor Defferding.
Thank you, Mr. Chair. I think it's important to realize how we got here in Winnebago County in regards to COVID cases. The second wave, the proverbial second wave, didn't really hit until the schools were open, until the college was open. And I'm still scratching my head on why UW Oshkosh decided to go forward with actually allowing residents inside their dormitories. We have to keep in mind that there are places out there that there are countries out there that were able to contain the COVID spread without necessarily needing to have any form of government orders. Japan is a perfect example. Japan has a very high population density, and so when there is a communicable disease, they're it's a huge concern. But they only did a partial shutdown, but it wasn't. But it was already over before it began, and they've managed to mostly contain the spread in Japan without necessarily needing to have a lot of strict government orders. There's one key thing about that culture that I really admire, and it's just simply the mindfulness of others and the ability to actually having respect for everyone, and if they are sick, they wear a mask, and if they don't think that if they're not sick, but if they just simply want to prevent the spread and mitigate the spread, they all wear a mask. And they don't do it out of force. They just simply do it because they are respectful and kind. And furthermore, there's a couple of things that they looked at and analyzed when it came to how to mitigate the spread of COVID-19. It's something that they call the 3 C's: closed spaces, crowded places, and close contact settings. And especially avoid those areas that involve a lot of loud talking, because it's actually kind of more of an aerosol-based virus. So they all pose a major risk of infection. And of course, the moment that the schools went open, those 3 C's were completely violated in Winnebago County. It is no mystery to me on how the virus spread so quickly, and so it spiked, at the beginning of September. So, and the thing of it is with these powers that we decide to grant the Director of Department of Health, with these powers, we are then mostly, I honestly do not think that this method of enforcement is actually going to be going towards the places where there's going to be a lot of spread of communicable diseases. It's actually going to be most likely hurting the small businesses. And we're already seeing that right now. I'm seeing a lot of dreams die over the last year. A lot of places have gone bankrupt. We're starting to get fatigue from all the different orders out there from our state government and partially from our local government. But it's so I think that we're suffering a lot economically, and we're suffering a lot just mentally speaking too. I spoke with the coroner's office today, and it appears that our opioid overdose deaths have more than doubled in 2020. We went from 15 in 2019 to at least 25, with a possible 8 more that's coming in. So that almost matches the amount of COVID-19 deaths that we have in Winnebago County. Furthermore, there's still the issue of suicide that has been increasing in the state of Wisconsin, and Winnebago County is no different. We're becoming very depressed. We're becoming very depressed because we cannot, we're just not able to socialize. We're not able to actually fight this virus, but also at the same time find a way that we could fight this virus, but also still be the social creatures that we are as humans. I just think it's kind of a direct, it's just a direct attack of who we are as humans, and our ability to voluntarily prosper. And so I think that it is highly possible for us to actually mitigate the spread without necessarily needing to have government orders, and without necessarily needing to have some sort of strict ham-fisted laws or rules or regulations. I think it's up for us to set that precedent. And if that means that if we have to make the voluntary decision to close down businesses, at least it's done with our consent. And that's very important. We have to have that consent. If we allow this method of enforcement, there is no consent, and there is no consent of the governed. So, so because of that, I just simply cannot support this, and I am resignedly voting no on this particular ordinance. So I just hope that everyone considers that, and I should let you know that COVID is definitely real, and it is definitely something that we should that we should battle. But I don't think that government rule and law is the way to do it. We have to keep in mind that this is not just setting the precedent for today's director of Department of Health. This is setting a precedent for all the future director of Department of Health. So it's I trust Dr. Guerin. I trust him. I think that he's a good guy, and he's got very good intentions. But this isn't about today's director of Department of Health. It's also about all the directors in the future too. And we have to keep in mind the context too for what's going on today. There's a lot of civil unrest because we have a lot of because there is a big issue going on right now in regards to police brutality and qualified immunity. And there's a lot of protests going on in the street. With this, and if we decide to allow this method of enforcement, it is highly possible for the director of Department of Health could simply say that that people cannot protest out on the streets, cannot exercise their right to the freedom of expression. I don't think that Dr. Guerin would ever do that. I think that, but again, this isn't about today's director of Department of Health. It's all about what's happening in the future too. So we have to keep in mind that precedent going forward. So I so yield. Thank you.
Thank you, Supervisor Defferty. Next speaker is Supervisor Buck. Please go ahead.
Yes, thank you, Mr. Chairman. Just I guess a question maybe for Executive Harris, or I don't know if Sheriff Motz is on here. We had seen with Secretary Palm's Safer at Home order repealed that there were sheriffs across the state that said they would not enforce that. I don't know if Sheriff Motz is on here, or if that's something that Executive Harris can answer for the sheriff.
Sheriff Motz, if you're on the call, or Executive Harris.
if Mats is not on the call, then I can answer that. There would be the authority for if this passes. Right now, no one can enforce a health order from the local health department. But you could enforce a health order from the state. If this passes, then local orders could be enforced as well. And the sheriff would have the ability, typically it's a civil fine. They could fine someone for instance, allowing a large number of people in their business without a mask or holding a large unmasked event. But as to whether the sheriff would actually do that enforcement is probably another question. People within the health department could issue citations as well. But the truth is they very seldomly go to that step. Having the legal authority to do so gives them the leverage to work with the people to get them to comply. Most business owners will comply out of negotiation with the health department. It's very rare that they actually have to go to the enforcement step. But without that authority, you're going to get a lot higher level of defiance by the public.
That's all I have. Thank you, Executive Harris.
Thank you, Supervisor Buck. Next speaker is Supervisor Lenz. Please go ahead, Supervisor Lenz.
Thank you, Chairman Ramos. We find ourselves in a challenging time. Like myself, I suspect my fellow supervisors have been both asked to vote for this as well as to vote against it. I will not be another. Tonight, we have been given an ordinance to vote on, not an order. While the ordinance in itself does not make action, it does produce a conduit from which action can occur, and that's pretty huge. And with the honor of carrying the supervisor title, we now have the burden to figure out what the right thing is to do. Before I can make my decision, I do have a number of questions that I either need answered or verified for me. The first question is in regards to the state statutes. I was able to, I believe, conclude that the responsibility for issuing and enforcing health orders in the state of Wisconsin would fall on the local health officer. Is that correct?
Corporation Counsel Mary Ann Miller.
You're muted, Mary Ann.
Corporation Counsel, you can go there. You're.
Okay.
We can hear you now. Please go ahead.
Can you hear me now?
Yes, we can. Thank you.
All right. In terms of the enforcement piece, and I'm sorry, Supervisor Lenz, can you just repeat your question?
The question is, according to the state statutes, who is responsible for issuing and enforcing health orders in the state of Wisconsin?
It would be the local health officer pursuant to the state statute. And in terms of the various types of orders, as you know, per statute, state statute, there can be isolation and quarantine orders. And then again, there are individual orders, and then there are general orders, all right? And in terms of enforcement of the general orders, in order for the local health officer to have that enforcement capability, you would need, or there would need to be an ordinance allowing him to do that. Right now, he does not have the ability to enforce these general orders. In terms of individual orders, there can be, the local health officer can petition the court for an order. He can also, basically, if there was an ordinance passed, enforce an individual order under, let's say, this ordinance if it were passed. But if you had had a chance to review, essentially, I call it the encyclical put out by the firm that was retained by the Wisconsin Counties Association, you will see that there are various types of orders. But in terms of general orders, and that's part of why we're here today, in order to be able to enforce a general order, there would need to be this ordinance that all of you are considering to be on the books in order for Doug Guerin or any local health officer to be able to pass that.
Okay. So if he wanted to issue a general health or a general order, would he be able to do that, or is he not able to because our local code is not up to date?
He cannot do that as we sit here tonight. If you were able to, if you passed this ordinance, then he could. But then, as you could see with the general order, there would be a period of time where he would then be able to go to the board, and then the board could either give Doug Guerin its blessing, or if it did not do that, then it would not be an order, it would be essentially a directive.
But that's
So
only if we pass this, correct?
Correct.
Okay, so in other words, he has the ability, he does not have the ability right now, if we do not pass this, to offer a general order in Winnebago County.
That is correct.
So that sounds like it's an
He cannot enforce a general order. Yeah, he does not have the ability to have enforcement. He has the ability, he has always had the ability to basically issue orders. The key is enforcement. And you can actually look at the state statute. I know there were references to the fact that, oh, you know, he does not have the power to issue orders. But if you look at the actual language in some of the statutes, specifically, I think it's 252 065 and 252 066B, it specifically references the fact that the local health officer can issue orders. So the order is not the piece, as you've indicated, it is the enforcement that is the issue.
Was there a state Supreme Court ruling earlier this year that said that we can't issue any orders if we can't enforce them?
No, I don't know if you are referring to the Supreme Court order that was addressed to Secretary Palm. I can tell you that situation is very different than what we have here today. And basically, in that case, the Supreme Court in Palm interpreted the Wisconsin Department of Health Services authority to issue orders, okay? It did not address local health officers' ability to issue orders. And I would also point out that the Attorney General's office issued an opinion regarding the Palm decision, and the Attorney General's office specifically said the Palm decision did not directly control powers under the local health officer statutes, because again, the Palm decision only analyzed granting the Department of Health Services authority with respect to communicable diseases. What they were looking at was 25202, which is the Department of Health Services. The local health officer is governed by 25203. But I will add that in the Palm decision, the court was concerned about making sure there was no overreaching. And I know a number of people were talking about that. The fact that we have incorporated into this ordinance the ability to basically have the enforcement piece reviewed, or the order reviewed by your board, I believe, addresses any concerns that the Supreme Court had in regard to overreaching. Although again, in the Supreme Court decision with Pond, they were looking at the Department of Health Services. They were not looking at the local health officer.
Okay, so that decision does not, from the best of your knowledge, set any kind of precedence at the local level.
No, it does not. It could, you could suggest that, well, there's a corollary because you have a local health officer, but it was not, and I have said it since May, it was devoted to 25202, not 25203, and that was echoed by the Attorney General's opinion. So, yeah.
So then a few more questions. I'm keeping you on the hot seat. I apologize for that. Do we as supervisors have the authority to pass an order of this type as it's drafted with the amendments?
Yes.
And does that conflict with either our state or federal constitutions?
No, and I know that Executive Harris referenced it. I think what is really important to note, and I just want to make sure I have the language. There's been reference to this this United States Supreme Court case. I'm not talking Wisconsin, I'm talking United States Supreme Court. And it was Jacobson versus Massachusetts. And essentially, as County Executive Harris referenced, Mr. Jacobson had refused to submit to a smallpox vaccine in defiance of a Cambridge, Massachusetts regulation. Apparently, he was brought to trial. A jury found him guilty, and they ordered him to pay $5 in 1905. And Mr. Jacobson was offended by it, and he appealed the decision to the United States Supreme Court. This is still good law. This is the seminal case on this point. In a 7-2 ruling, the United States Supreme Court affirmed the Johnson guilty verdict and specifically said governmental restrictions of individual liberties were certainly appropriate to protect the greater public welfare in the face of a health crisis, end quote. Now, I would say that this principle is illustrated in the broad powers that are granted to local health officers in Wisconsin statutes.
Appreciate it. So now questions about if this order were to pass, or this ordinance were to pass. Based off the verbiage that's in front of us, does the county, it looks like the county board has the ability to review and reaffirm the order if needed. And it also looks like the county board will have the ability to review and revise the order. Does the, I'm sorry, this is in reference to general orders. Does the county board have the ability to review and deny a general order?
The county board does not have the power to issue general orders. What the county board has the power to do with this statute is to review the order that was issued by the local health officer. And if the county board believes that there is overreaching, then that order that was issued no longer is an order. Essentially, it is a directive.
Okay.
And you'll see there are time limits referenced because obviously time is of the essence. It said any general order is advisory only until reviewed and reaffirmed or revised and affirmed by the Winnebago County Board of Supervisors. But I want to point out that, again, the power to issue orders rests with the local health officer. Your board is the advisory board, the reviewing board.
Understood. The question was more around the verbiage of revise. Under revising, do we have the ability to decline or deny a order that was issued by the health officer?
Yes, you can say, I don't agree with it. Yeah.
Okay. Then I don't know if this last question is for you or if it's for Shiloh, but I believe that the appropriate checks and balances are put in place for a general order. What I'm struggling with is the individual order. Why did we not put the same type of oversight against the individual order as we had with the general?
Because with individual orders, there is clear statutory and administrative rule authority to enforce individual orders. There is statutory authority for that.
So if we were to strike the verbiage about the individual order today, would our health officer lose any abilities to issue necessary individual orders?
Well, again, under enforcement of individual orders, there are 3 ways that our health officer could seek to enforce them. And again, these are individual orders. These are not general orders. Number 1 would be to petition the court to order a person in violation of an order to comply. And that's referencing Administrative Reg 14506, which talks about, okay, you need to go through some education. Okay, you need to undergo exams. You need to appear before the local health officer for testing. So that is one way. A second way would be, again, petitioning a court under 14506.5 as opposed to 14506.4. 14506.5 would be obtaining a court order to enforce public health orders issued as to owners of specific businesses. However, there is a third way, and that would be if you pass this ordinance, then there could be enforcement of individual orders under the authority granted under this ordinance. So this ordinance impacts not only general orders, but individual orders.
Okay. I'm still a little cautious here in regards to offering a new conduit for the health officer without having any board of supervisors accountability. If I were to offer a amendment that reads such as any individual, so this would be an addition after line 95, any individual order is advisory until reviewed and affirmed and revisited and infirmed by the Winnebago County Supervisors at its regularly scheduled meeting date or within 14 days, whichever is earlier. All individual orders would specify duration for the order and the expiration date, but will have a maximum duration of 60 days unless otherwise authorized by the county board. Similar language to what we currently see in the general order. If I were to offer that here, would I create any kind of contradictions or issues from a legal standard?
Yeah, I believe you would be undermining some authority that is given to the local health officer via statute.
Okay, so that would be inappropriate for us to undermine state statute.
Yes.
So if I were to remove verbiage around the individual order here, all we would do is leave the health officer with those 2 already established conduits for offering orders. And we would remove any reference to an order that would not have board accountability. Is that a correct perception from your opinion?
Yes, it is.
Okay, then I would like to offer an amendment to remove lines 94 and 95, edit line 96 so the number 2 isn't there. I'm sorry, that was on the old draft. Let me bring up the new one.
Yeah.
Those lines would be now.
You're looking at the amended. I'm sorry, go ahead.
remove lines 100 and 101. Edit line 102 to get rid of the number 2. Line 98, we would get rid of the reference of or individual orders. And I apologize, but I haven't scrubbed through the rest to any other comments where it speaks from that point forward, where it speaks to individual order.
Supervisor Lenz, if I could just say that, again, this 46-page encyclical that was spent, that basically the firm for the Wisconsin Counties Association spent the better part of the summer putting together, specifically, while they did not provide a template, gave pointers. And they specifically noted they would recommended that you reference orders and general orders. And again, I just want to give you that background because there was a lot of time spent referencing general orders versus individual orders. I didn't mean to interrupt your train of thought, but I thought it was important for you to know that.
I think I finished my train of thought. I just want to make sure I'm not creating any kind of holes in our code or anything that will contradict state or federal statute. But I also don't want to create a situation where the director has the ability to issue an order where the state, where the county legislators, the supervisors are not able to review and account for it if needed. So if that is already in the intent, then I don't need my amendment. Otherwise, I would like to continue with my amendment.
Supervisor Lenz, could you please clarify if you're making an amendment, if you could please recite the entire amendment?
So it would be to remove lines 100 and 101. And then just to make it consistent, we would remove the or individual orders in line 98. In line 102, there would be no longer a need for a number 2. And then if there's any further, I don't recall seeing any further reference to the individual order from there, that point forward.
Okay, I'm writing this down so that I can repeat it for everyone and make it sure it's accurate for what you're looking for. Okay, so the amendment at this point, which I suspect needs additional changes, but I'll refer to them in a minute to you since it's your amendment, is to remove lines 100 and 101, to remove the words or individual orders in line 98, and change in line 102 the numerical number 2 to 1. Is that correct, Supervisor Lenz?
That would work.
And so the only thing I want to bring up to you, it's your amendment, of course, but to stay consistent with what your goal or intent is, as a part of this, you would probably remove lines 75 to 77, defining what an individual order is.
I was thinking about that. However, I don't know if there needs to be distinction from a contrast perspective so that folks can understand better what a general order is. But if it looks like it will create confusion,
I guess I would ask the Corporation Council if that's not necessary to remove it. It's not my amendment. I just wanted to bring it up, Supervisor Lenz.
Point of order.
So we're clarifying the amendment because he's offered an amendment so that we can determine if there's a second. We need to verify what the actual full amendment is.
I'm looking, Mr. Chairman, I'm looking at my copy of the resolution, and it's not congruent with the information and changes and specifications that Mr. Lenz, Supervisor Lenz, is speaking.
And just to confirm for you, Supervisor Eisen, to ensure you're looking at the amended ordinance, the one that says amended on top, is that accurate? It should say amended 096-10-2020.
I'm looking at line 100 and 101. Is that the relevant lines to strike?
Yes, that's part of his amendment, is to strike those.
100 says orders will specify a duration for the order and an expiration date, but will have a minimum duration of 60 days unless otherwise authorized by the county board. That's precisely what line 100 and 101 says. On my copy.
You have the same as I have, and those aren't amended yet.
So what he is referring to is the amended copy that you will see on the county board website.
Well, I'm very sorry. I was sent this by the county board. This is a default, and you should immediately reschedule this when you get the act together.
I can't speak for what you were sent, Supervisor Eisen. I can only speak for the copy we're referring to.
I have a paper copy right in front of me, and it's not congruent with what you're debating.
Chairman Rob?
Yes, please go ahead, Corporation
I will
Counsel.
not vote on this issue.
Thank you, Supervisor Eisen. Go ahead, Corporation Counsel.
If we could just point out to the supervisors, if you look at the front page of your document to the top left, on the first page, it should have amended, all bold uppercase. That was an ordinance, an amendment that was sent out by, I know the county clerk a few days ago. If you do not have amended.
That copy. I do not have that copy, and I never received it.
Thank you, Supervisor Eisen. Please go ahead, Corporation Counsel.
Mr. Ramos?
Supervisor Cox, yes?
Yes, sir. I'm in the same boat. I've got an old copy. It's not the one that says amended on it.
So it sounds like, to answer.
I also don't have it.
So to answer your question, Supervisor Cox, it sounds like that was sent out as an email, which probably is the situation for Supervisor Konecki, I'm guessing as well.
Chairman Ramos, I don't have it either.
But Chairman Ramos.
Yes, Supervisor.
I was given this in a packet. It was sent to me in a packet, and that was, I think, Saturday I got it, the Friday or Saturday.
Okay.
All right.
And it's clear that you didn't receive the amended version.
Right.
Thank you. All right. So Supervisor Lenz, you have the floor.
Or I think we left off with the question about, does it add value to have the contrast by having that individual order definition? Or does it add confusion? And I believe you propose that to council.
And I would say that keeping the definition individual order adds clarification.
Okay, so then I will leave the amendment as I had stated, which is the, according to the lines on the amended ordinance, we would be removing that 100, 101, changing the number of 102 to 1, and removing the reference of in line 98, the words "or individual orders."
So that's the motion to amend. Is there a second?
I'll second it.
There's a motion and a second, so that's what we're debating now. We're debating the amendment that Supervisor Lenz is proposing to remove the verbiage in lines 100 and 101, which say any individual order and potential enforcement action must conform to DHS 145.05 and 145.06 Wisconsin Administration Codes, and 66.0113 and 66.0119. To strike both those lines, and then in line 98, after the words general orders, to remove the three words or individual orders, and then simply on line 102, for clarity, to change the number 2 to a 1. So that is what we're debating right now, that motion to amend. So all discussion going further until we've decided on that amendment is in regards to that amendment. So I will call on Vice Chairperson Egan.
Can I speak?
Yes, please go ahead, Supervisor.
I wasn't going to speak on this amendment, but now we're convoluting this whole situation and we're just getting things more and more cloudy. So I'm not for that amendment.
Thank you, Supervisor Gabbard. Anything further, Vice Chairperson Egan?
Not at this time.
Okay. I'll then call on Supervisor Shorsey. Please go ahead, Supervisor.
I am not interested in speaking on the amendment.
Thank you, Supervisor Shorsey. Next speaker is Supervisor Rasmussen. Please go ahead, Supervisor Rasmussen.
Okay, now am I unmuted?
Yes, we can hear you.
Okay, I was trying to make sense of this because I didn't have that amended one originally, and I couldn't follow that either, but now I do. Is this about sending this advisory to the county board? Is that part of this, is what I'm hearing?
So this amendment actually essentially is to remove all verbiage related to the individual orders. And this ordinance would effectively be only in regards to general orders, if you strike all that language.
Okay, it's not the way I saw it, so I have nothing else.
Thank you, Supervisor Rasmussen. Next speaker is Supervisor Schellinger. Please go ahead,
Mr. Chairman. I'm going to be in concurrence with Supervisor Gabbard. I think that this is something that I will be voting against. I think the individual orders bring something important to the resolution that allows the health officer to have a few more options other than just a general order that would apply to everybody. Thank you.
Thank you, Supervisor Schellinger. Next speaker is Supervisor Eisen. Supervisor Eisen?
I would request a recorded vote on this issue.
Very good. We will do so. Any other discussion on the amendment to remove lines 101 and 100 and remove the words or individual orders on line 98 and change the number 2 to 1 on line 102? I'll call on Supervisor Powers.
Thank you, Mr. Chairman. I'm just wondering if we're changing number 2 to a number 1, is there any reason to do that? There is no number 2, so why do we have to have a number 1? Wouldn't putting a number 1 assume that there's a number 2?
Yes, or for clarity, it would actually be item E. But you're right, it probably is not needed because it could simply be a sentence on line D. I think that's what you're saying, right?
That it would become E?
Right, it could either become E or the last line of line D, but yes, that's what, it could be line E, it could be E, yes.
Okay,
But that is just so we're clear, that's not our amendment though, because the amendment was he requested change the number 2 to a 1.
well, it was more of a friendly amendment to make it more grammatical.
All right, very good. Any other discussion before we go to a vote on that specific amendment? Okay, seeing none, we are going to do a roll call vote. as requested.
Just a second.
Supervisor Cox?
Yes, sir.
Please go ahead.
Until I see the full amendment or amended version in print, I'm going to abstain of this ruling, of this piece of document. I had nothing to work with and nothing to look at and compare to what they want to make a change on.
So for you, Supervisor Cox, I recognize you don't have it in front of you, and that's unfortunate. If you're looking for that copy, since you don't have a physical copy, it is directly on the Winnebago County website under this county board meeting, and it's right at the bottom saying amended. If you click on it, you will see that document.
Thank you.
Thank you. All right, I see one other call in before we go to a vote. Supervisor Finch. Supervisor Finch, specifically on the amendment.
Yes, after listening to all this, a lot of people really, what I'm hearing, don't understand the whole thing, including me. So if at all possible, I would like to table this until next month, which will give us more of an idea on what we're actually voting for. So my motion is to table this until next month.
Second. So there's a motion and a second, and just to clarify, it wouldn't be a motion to table, it'd be a motion to postpone to the November business meeting of the county board. That's what you're really referring to. So I just wanted to make sure to clarify. And that does take precedence then. So that is the motion on the floor now to postpone this to our regularly scheduled business meeting in November. So any debate now, because that does take precedence in regards to the motion to postpone to the November business meeting. Any discussion on the motion to postpone? I saw a hand first, but I saw a hand on Supervisor Powers. So I'm calling her first. Please go ahead.
Thank you, Mr. Chairman. I would just say if we table this till November, we will sit through 2 more hours in November of comments on this proposal.
So what?
Thank you, Supervisor. Let's let one speaker speak at a time, please. So I recognize Supervisor Powers, Supervisor Finch, I recognize him. So next would be Supervisor Lenz, specifically on the motion to postpone to the regularly scheduled meeting in November. Please go ahead, Supervisor Lenz.
I just need clarification. Are we postponing, because we were discussing the amendment? So are we postponing the amendment or the entire ordinance? And can we postpone the ordinance while we're still discussing the amendment?
It's a very good question. The answer is yes. A motion to postpone overrides the regular motion as well as the motion to amend. So it does take precedent.
So then in our discussion, will we start off with the amendment, or did my amendment basically just get blown away without a vote?
If this motion to postpone passes, your amendment would not be originally on the floor. It would be the original amended ordinance that you see on this agenda that would be effectively on the agenda in November. So your ordinance would not be part of it. You would have to bring that amendment up again.
Okay, so the request to table this supersedes my request for my amendment.
Yes, it does.
Thank you.
Thank you. So I'll now call on Vice Chairperson Egan. Please go ahead, Vice Chairperson Egan.
Thank you, Mr. Chairman. As far as postponing it for a month, I don't know if that's actually long enough. I don't even know if we understand all of this. I'm going to say it, the reason that I voted against this, and I know it's on that other, but the reason I voted against this last Thursday is to get more discussion out into community and talk to the people in this and that and get all their inputs. I'm sure I'm not the only one that got a lot of telephone calls and from a lot of high ranking people too. I think it should either be voted down or we should put it off for more than a month and go ahead and work out with these people and get some better directions so we all know where it's coming from. So as board members, we're not sitting here arguing amongst ourselves, trying to decide and try to change things that we had been waiting for, that you as chairman went ahead and promised that you'd bring back, and you along with our Marianne went ahead and so elegantly put together. I just think that we should put it off and go ahead and work with the community more. So I don't think we should just put it off for a month if we're going to do that. Thank you.
Thank you, Vice Chairperson Egan. Next speaker is Supervisor Snyder.
Thank
Please
you,
go
Mr.
ahead, Supervisor
Chairman.
Snyder.
Thank you, Mr. Chairman. I'm against postponing it. Last week, I listened to the confirmation hearings for a Supreme Court Justice, Amy Coney Barrett. And you talk about power being invested in an unelected official. All you have to do is look at your Supreme Court. They get lifetime appointments. But one of the answers she gave said, government has an overriding obligation to respond to an overwhelming health crisis. Think about that for a second. Government has an overriding obligation to respond to an overwhelming health crisis. Why postpone this? Vote it up or vote it down. The longer we procrastinate, the higher the numbers are going to get. It's just that simple. Thank you.
Thank you, Supervisor Snyder. I'll next call on Supervisor Binder. Please go ahead, Supervisor Binder.
I agree with Supervisor Egan that I think a postponing is our best bet. I mean, some of us don't have the up-to-date copy of the amended ordinance. If we don't have it, the public don't have it. And I just think that we're voting on something that the public didn't know that there was an amended version out there. If they looked at the minutes or what we were going to discuss tonight on the agenda, they maybe didn't look at the amended version. I don't think with Governor Evers' order right now, the bars and restaurants are down to 25% capacity. I mean, they can't even make a living at that. I think we got time, to really think this over. And when we pass it, do a good job where the citizens that elect us are happy. At least, I've got probably 20 calls today, hundreds of emails, and I feel a responsibility to them that they probably don't have the amended version of this. So I don't think we should vote on it tonight. Thank you.
Thank you, Supervisor Binder. Next speaker is Supervisor Zelmer. Please go ahead, Supervisor Zelmer.
Thank you, Mr. Chairman. Can you hear me?
Yes, we can hear you well.
I really think we should keep forging ahead. There could be next month, there could be 2 or 3 more amendments, and we say, let's put it off again so that the public knows. I understand the folks that would like to do that, but I think we should just forge ahead and finish our business on this tonight. Thank you.
Thank you, Supervisor Zelmer.
Chairman Ramos,
Yes, Corporation Counsel.
just to add something, the amendments only referenced the definitions section just for those people who haven't seen or don't have the amended version in front of them. And if it would be helpful, since every other word was the same, I could look at the version, the non-amended version, and reference the lines that Supervisor Lenz was trying to delete or alter, if that would help. I'm just offering that.
I appreciate that. The only reason I'm saying to hold off is just because the motion on the floor is to postpone. And so we should keep it on that motion to postpone or not to postpone. I appreciate the offer. But she is correct. Just for point of information, because this is the reason we are postponing. So just so folks know, obviously if we postpone, I won't be speaking about what I was going to say, but it's important for you to know that the numbers only changed because I added additional clarification of the definitions of individual and specific orders because of comments, frankly, from the public looking for more robust definitions. And that, unfortunately, is why the copies you see now have different numbers, but for no other reason than that. But the debate right now is on the postponement. So I'll recognize Supervisor Eisen. Please go ahead, Supervisor Eisen.
Thank you, Mr. Chairman. I support postponement, and I believe and I feel it is only appropriate to postpone because there's a procedural defect in the resolution. And a minimum of 2 supervisors have declared publicly that their copies are defective. And no notice was given of the change. Thank you.
Thank you, Supervisor Eisen. Next, I'll call on Supervisor Newhoff. Please go ahead, Supervisor Newhoff.
Thank you very much, Mr. Chairman. I just want to point out that Clerk Ertmer sent out the amended agenda notification more than 24 hours ago to over 160 recipients. And I do believe that it is the responsibility of each supervisor to make themselves aware. Thank you.
Thank you, Supervisor Newhoff. Next speaker is Supervisor Lenz. Please go ahead, Supervisor Lenz.
Earlier in this evening, I believe, Shiloh, you had referenced or made a amendment to those definitions by adding a line. I am curious to why this conversation didn't come up at that point.
Please clarify at what point?
The point where you added the line to the definition on general order in regards to business, and we had a dialogue around it.
Oh, you are asking why other supervisors didn't bring up the issue with having one copy versus another when that amendment came up. Is that what you're asking?
Yes.
I think I actually can answer that partly, but I can't know because I don't have the copy in front of them. But it was changes in those individual and general orders that would have shifted lines down. Although you're probably right, by changing the definition of individual, it probably would have bumped those lines down as well when I made that amendment. I would think you're accurate. I can't speak for why it didn't come up at that time.
And the only other thing I can say is, this is difficult. And the state did say that this is a decision that needs to be made at the local level, at least to my understanding. I think we have the fortune to be supervisors, but unfortunately it comes with the burden of having to make these tough decisions. And I just want to ask supervisors rhetorically to think, do we want to postpone this because we don't want to make the decision? Or are we postponing this because we are genuinely confused? And I will leave it at that. Thank you, Chairman Ramos.
Thank you very much, Supervisor Lenz. I will say before we go to a vote, this is obviously unfortunate. To have individuals who do not have that physical copy. I made a reference earlier. I was prepared to make some comments about this, and frankly, to give a fair amount of background, both more to the public, similar to what I did at the Board of Health meeting, as well as some additional comments. But obviously, I can't do that tonight unless we decide not to postpone. I will tell you, however, in my view, it's unfortunate that folks did not have the copy, but I admit I have difficulty going forward with this if truly there are supervisors that are struggling with whatever copy is in front of them. So I was going to allow the debate to go forward to see if it would come up in terms of a motion to postpone. It did, and I do support that motion to postpone. So I guess I want all of the board to know that that's difficult, because I think it's unfortunate for us to end up waiting another month, to be truthful. But it's also difficult for me to move forward if there are several individuals who don't have that copy. Now I see there are additional calls since then, so I'm going to recognize Supervisor Wingren. Please go ahead, Supervisor Wingren. We're working to unmute your mic, Supervisor Wingren, so bear with us. So Supervisor, okay, so if Supervisor Wingren calls in again, we'll certainly recognize him. We'll go next to Supervisor Fari, then Supervisor Schneider, and then if Supervisor Wingren hopefully is able to come back, we'll certainly recognize him. So Supervisor Fari, please go ahead.
Thank you, Mr. Chairman. As I indicated, I might have received that email, but I don't believe I opened it far enough to see the amendment. But let me read through the rules of the board. 8.3, an agenda, hold on a minute, along with the appropriate attachments shall be mailed or otherwise deposited for delivery at least 7 days before the board meeting. This clearly indicates that if there was an amendment made, it should have been mailed out and delivered to us individually. Now, we've done that before. In fact, I had law enforcement one time deliver a packet to me. So relying on emails to amend a ordinance is, I think, a little flawed. I really do. And I don't really agree we should, postpone this. I'd rather decide it tonight, but I really think we have to live by the rules we have written.
Thank you, Supervisor Fari.
Would you agree with that position or not, sir?
No, I don't agree, because if there are individuals here who really don't have that copy, I think it makes it very difficult for us as an entire body to truly vote and consider this tonight, especially if there are additional amendments.
I'm referring to the process.
Oh, I actually can speak to that. So that's an interesting question you bring up, because I agree with it. And I'll actually have to talk with some folks behind the scenes to see how we can improve this, because I know what my intent was. That doesn't mean I made it clearly. So let me explain so everyone knows. At the Board of Health, I offered up those two definition changes. And when they passed, I even mentioned at that Board of Health to all the public and the Board of Health that please know that those definitions won't be on the agenda that comes for today. But then, of course, I would be offering up an amendment because it essentially was a recommendation of the Board of Health. But if there was any error there, that I blame myself. But certainly the intent was to do exactly what you're asking. In other words, the agenda would have stayed the same with the original ordinance, amended ordinance that Supervisor Eisen is looking at. And then I would have advised this board that the Board of Health recommended those definition changes and then offered those as an amendment to them.
Yes.
And that's once again why I'm supporting to postpone.
Good, I agree.
I'll next call on Supervisor Schneider. Please go ahead, Supervisor Schneider.
Thank you, Mr. Chairman. I tend to go along with Supervisor Newhoff. I have 4 different email addresses. I still have the updated copy in front of me, printed it out. It's not that difficult, people. I mean, we are supervisors for a reason, and we're supposed to know what we're doing. And I just don't support postponing it. Let's vote this postponement down, go back to the amendment and get this done. Thank you.
Thank you, Supervisor Snyder. Next speaker is Supervisor Lenz. Please go ahead, Supervisor Lenz.
This puts me in a tough spot. I fully agree with Supervisor Snyder. Unfortunately, I have to agree with Fari also. We did set rules for ourselves. We did agree to them through a vote. So because we have a precedence, we need to follow it. I think we've seen enough governance not following their own precedents. I don't want to be part of that. So I do agree to postponing. But I do strongly urge both the health department as well as the county executive to take advantage of this moment if we do postpone it, to get a good communication out there to the public. I think it was seen clearly tonight that a lot of folks didn't have the full information or were looking for more information. And that's all I'll say on that. Thank you.
Thank you, Supervisor Lenz. Next speaker is Supervisor Rasmussen. Please go ahead, Supervisor.
Thank you, Mr. Chairman. You know, there's a lot of stuff going on here. First of all, our packets were sent out 7 days before the meeting, and then the health committee met after that. That's a problem because of all this. This thing is such a complicated mess. We heard all the comments from 200 people, whatever it was. They don't even understand it. There was things said there that weren't in here. How many of us can even follow this thing? And as far as when the amendment was sent out, yes, it was, but I can speak for probably all of us. I had about 500 emails in the middle of all that. How can you even follow that? It's just a mess. I don't want to see this postponed. I think this needs to be settled, but there are real issues here in the process of how this happened. And it's just a complicated mess. And if we don't do this tonight, we have to go through this again. We went through this in June. We're going through it tonight. Now we're going to go through it again. To me, this is, I mean, I could go into my reasons about how I feel about the resolution itself. And I know we're just talking about the postponement, but this is just a whole lot of mess for nothing as far as I'm concerned. Thank you.
Thank you, Supervisor Rasmussen. Next speaker is Supervisor Wingren. Please go ahead, Supervisor Wingren. Supervisor Wingren, there you go.
Thank you.
Please go ahead.
Thank you, Mr. Chairman. With great respect for all the people that have spoken, do we get it? Get it? I got the email from the county clerk as was required. I read it. I read my emails. I prepare for these meetings. To say you didn't get it, that really that bothers me. We need to make a decision tonight, for heaven's sakes. Do we get it? This is a national pandemic, a worldwide pandemic, and we're sitting nitpicking because we don't read our emails, we don't prepare for the meeting. This is ridiculous.
Thank you, Supervisor Wingren. Next speaker is Supervisor Defferding. Please go ahead, Supervisor Defferding.
Thank you, Mr. Chair. Are you able to hear me?
Yes, we can hear you well.
Okay, well, it looks like I'm the last call in here, but I was going to call a question.
All right. I don't think you need to, Supervisor Defferding. All right, very good. So there are no other call-ins. So I am going to attempt this via voice vote. If it's not clear, we will of course go to a roll call vote. We'll try this first, see where it goes. So the motion was to postpone the amended ordinance 11.08 to the November business meeting. All those in favor say aye.
Aye.
All those opposed say nay.
Nay.
That motion carries. So it is effectively postponed to the November County Board business meeting.
Hooray,
So
hooray.
that leaves one more item on the agenda this evening, and that's resolution number 097-10-2020. For that, I will call on Supervisor Norton.
Thank you, Mr. Chairman. I move for adoption of 097-10-2020.
Second.
There's a motion and a second to approve resolution number 097-10-2020. Any discussion?
Just a few things I want to say, Mr. Chairman, and I'll leave the floor to whoever. I tried to present this to the Personal Finance Committee. The chairman of that committee, by the urging from one of those members of that committee, would not take it up. I'm bringing this forward for a couple of different reasons. One reason, there was a similar resolution the Personal Finance Committee did turn down, but that pertained to certain workers, I think Parkview, some in the Sheriff's Department, whatever. And I thought, as someone else thought, that maybe the whole county board should discuss that. I made it more general because I have heard a couple of different Personal Finance Committee meetings about including at least one other department. So I thought if I brought it up, the whole county board could just debate it, decide on, and if every worker gets it or no worker gets it. And I want to just lastly add that, it was mentioned by a couple of the speakers who spoke against it about what the general workers or general population. Well, Mr. Chairman, as you know, I work at a regional grocery chain in this area, and all of my fellow coworkers, both full-time and part-time, got what we call, I don't know, hazardous pay or bonus pay because of this epidemic. So that's why I'm proposing it. So I'll let it go.
Thank you, Supervisor.
Mr. Chairman?
Supervisor, I will call on you. Finish it. Please raise your hand, please. Next is Supervisor Wingren. Please go ahead, Supervisor Wingren.
I'm sorry, I was going to ask for a recorded vote on that previous one, but I wasn't recognized.
I apologize that I didn't see that. Next speaker is Supervisor Shorsey. Please go ahead, Supervisor Shorsey.
Thank you, Mr. Chairman. I guess it's a no night for me. And we had quite a bit of discussion about the original request, which was for employees who had direct contact with people who were known to be positive COVID. And I think that by offering a bonus to all employees, it certainly negates any kind of bonus or any kind of special recognition that we were giving employees who are at greater risk because of their work. So I think this is a really bad move. We had the benefit of a market study with our call-in comments and to give us an idea of what kind of reaction we're going to get from taxpayers. So I would have supported something that was, if we have other departments that are working with people who are known COVID positive, that would have been a different issue in my mind. But I think this is totally out of line and unnecessary and actually does damage to what we were trying to accomplish at the last meeting by recognizing special risk on the part of some employees. So thank you.
Thank you, Supervisor Shorsey. Next speaker is Supervisor Jones, followed by Supervisor Rasmussen.
Thank you, Mr. Chairman. Just had a question on the resolution. I know it mentions that a portion of this expenditure may be reimbursed from federal and state monies. Would the full amount possibly be reimbursed by federal and state monies or only a portion of it? Thank you.
Thank you. I'll call on our finance director to answer that question.
They were referring to the Roads to Recovery CARES grant monies. And I wrote the Department of Administration to ask them that, and I was told that the majority, if not all of it, will not be reimbursable. They have certain criteria that the person has to be in harm's way in order to have hazard pay. So that they actually have to be in physical harm's way. And I wouldn't be able to tell you how many of those employees would be in harm's way. I don't know if the director of human resources could tell us that, but otherwise, I would say the majority would not be reimbursable.
Thank you.
Thank you.
Thank you, Director Fitzgerald, and thank you, Supervisor Joyce. Next speaker is Supervisor Rasmussen, followed by Supervisor Lenz. Please go ahead, Supervisor Rasmussen.
Thank you, Mr. Chairman. I just wanted to say here why we didn't have it in committee. It was a little bit different resolution that was given to me. I did talk to the vice chair of the committee about this, whether or not we should leave it on. There was just some real issues with it. And my response back to Supervisor Bender with that was that I'd seen the resolution. There were too many inconsistencies, that I wasn't going to put it on P&F agenda unless it was vetted by HR and truly determines which employees are actually in harm's way from COVID based on their job requirements. Part of that was because of it wasn't reimbursable, which was on the original one. Another part of it is part of the inconsistencies. I mean, you look at the new one and it says anyone who's been working since March 17th. So someone who started March 18th can't get it, or someone who worked all the way through till last week won't get it. It's just so inconsistent. What about the people that got the $1,000 bonus last time? Do they get it? Like Supervisor Shorsey said, it just negates everything that happened. We talked last week, I know I talked at length about certain employees that weren't making comparisons, and not everybody is in harm's way with this. And it just didn't seem like it was worthy of putting on there with those inconsistencies. And of course, the different one has some different things on it, but that's the reason we didn't put it on the P&F agenda. I did talk to the HR director, and I do not want to put words in his mouth, but it was right before our meeting then that he just kind of said, this really is unworkable, because how are you going to go back and do this? You start picking and choosing who gets it, you give it to everybody, that's bad morale. This thing is just going to cause bad morale all the way along. I guess I'll continue with my feelings on it. Besides that, to say that all county employees are meeting extraordinary demands and under very stressful conditions. You know that about 40% of our employees are working from home? Where's the COVID extraordinary demand on that, more than the rest of the citizens of this county? What about examples of people? One that really stuck with me at the same time. Got my teeth cleaned about a month ago. My dental hygienist is leaning over an open mouth of me and dozens of people every day. She didn't get a bonus. People like that, people that do that every day, it's just not right. We're talking about our employees, and one of our old colleagues, I don't think he'd mind if he was listening that I use this. I didn't talk to him first, but our old colleague that many of you would remember, Stan Klein, one time when we had an issue like this, said, we not only represent the 1,000 employees of the county, we also represent the 169,000 who pay for it. And I think that really enters into this at this time. This just is not the right thing to do. For example, back in May, I believe it was, when we had the tax, the Act 185, I think it was, I don't have it right in front of me, but the tax thing, some of the same people that sponsored this one wanted to give a tax holiday, and it got passed because people couldn't afford to pay their property taxes on time. And now we want those people to pay a bonus to only county employees. This isn't anything against the work of the county employees at all. This is about COVID has affected everybody in this county in different ways, and to single out like that just isn't right. There's so many people that have lost time, been furloughed and a lot of things, and they own homes and they still are paying county taxes. And to say that because we have a fund balance that we should just hand it out, no, that's not what that fund balance is for. We explain that of things that we want to do with that fund balance, with our rating and different things like that. And as far as the county workers and deserving something, there's a lot of things that probably in the past that have nothing to do with COVID. You go back to our how many dozens of employees, salaried employees that are still there that got froze out for 10 years. We never addressed that. We haven't addressed the fact that our merit pay plan doesn't have enough money in it to make much of a difference between the categories. Those are things that can happen for our employees that can be taken up at budget time, but not at this time. But to say that our employees need a bonus because of extraordinary demands from COVID and paid for by everybody else who had extraordinary demands by COVID just isn't right. This to me is nothing but everybody gets a trophy thing, and this isn't the time for that. Thank you.
Thank you, Supervisor Rasmussen. Next speaker is Supervisor Lenz, followed by Supervisor Finch. Please go ahead, Supervisor Lenz.
Thank you, Chairman Ramos. I do believe that a good number of our county employees have been asked to be put in harm's way, even though that wasn't in their original job description. And we don't have control over the private industry, and I don't think we should. But where we do have control, I think we have a responsibility to acknowledge the commitments and sacrifices of those who have unfortunately had to go in harm's way. That being said, I would recommend to the team that put this forward to maybe take it off the agenda before it gets voted down. And the reason for this is I think there's a few things that should be taken further into consideration. One, what do we do with those folks that already got some sort of recognition? Two, I'm not seeing anything in here that defines what we're going to do for those contracted employees. I believe the Sheriff's Department is under contract, and I don't know if we've reviewed with them to see if we've created an issue with that contract if we just simply give them money. So that's all I'm really going to say there. I am going to just emphasize many of the private industries have done a great job during this whole crisis, and we should all applaud them. What I see here is us doing our job because this is our employees. But like I said, I think this resolution does need more consideration for a couple other aspects. Thank you.
Thank you, Supervisor Lenz. Next speaker is Supervisor Finch, followed by Supervisor Ellis. Please go ahead, Supervisor Finch.
Thank you, Mr. Chairman. I'm just letting you know that I will not be voting on this subject. I have family members that work for Winnebago County, so I'm going to stay neutral. I'll be no voting one way or the other.
Thank you, Supervisor Finch. Next speaker is Supervisor Ellis, followed by Supervisor Eisen. Please go ahead, Supervisor Ellis.
This resolution probably should be pulled by one of the co-sponsors here because I just don't think it's right at this particular time, and possibly should be rewritten a little bit different if they certainly want this. It's missing quite a few things. Thank you.
Thank you, Supervisor Ellis. Next speaker is Supervisor Eisen, followed by Supervisor Egan.
Thank you, Mr. Chairman. $549,885. That's what we are asked to appropriate to provide $500 bonuses for Winnebago County employees. The 2021 levy is proposed to be an increase by $1 million. And this resolution asks the county board to add $549,885 expense to 2020. It is difficult to convince me to bonus employees for doing their job. I only wish the proponents of this resolution had done some homework. And I did some homework. And what I found out was 26 Winnebago County employees had taken off work due to childcare needs by COVID. And they received 2/3 pay for their time off. A total of 107 employees have received up to 2 weeks off because of COVID at full pay. An additional 134 county employees have received up to 2 weeks off due to COVID at full pay under the county provided benefit. And approximately 300 county employees have been authorized to work from home during the pandemic. There is, to me, insufficient justification to provide a $500 bonus and expend $549,885 of taxpayer money.
Thank you, Supervisor Eisen. Next speaker is Supervisor Vice Chairperson Egan, followed by Supervisor Binder. Please go ahead, Vice Chairperson Egan.
Thank you, Mr. Chairman. Just about everything has already been said, what I was going to say. Mr. Eisen said a mouthful there about how many of these people are already getting money from the county over and above, and how many are just staying home because they're afraid of the COVID or whatever. Some are still being paid on that. I just think that 500 and some thousand, we can go ahead and make better use of at someplace other than just there. I think our employees are just great. I'd rather go ahead and give them a raise at bonus time and go that way so they have so much coming all the time than a one time. That way everybody would get it instead of just the COVID people. Because I bet you there's people out there, I know a couple that works at the parks that is working in the lines out there, we might not even think of. And they work with the COVID every day. So I think that we should be careful on how we go about doing this. And I think that either we should relook at it or go ahead and think about possibly a raise instead of this kind of a bonus. Thank you.
Thank you, Vice Chairperson Egan. Next speaker is Supervisor Binder, followed by Supervisor Schellinger. Please go ahead, Supervisor Binder.
Last month, we talked about transparency, and we gave Parkview, basically the people that take care of the COVID patients there, got a $10 an hour raise increase. I know there were positive cases at the jail, and they basically get between 17 and 40 people a day, inmates. They don't know if they're positive, negative. They have to test them. They have to keep them isolated. When they have a COVID inmate, they have to basically take the precautions. And yet they didn't sign up for that when they signed their contract. You know, they signed up like everybody else to do a job. They didn't realize that they're basically going to be in jeopardy. They have to give that guy 3 meals a day. They have to basically take care of his clothing, you know, and we're going to overlook them. At the Parks Department, they had a seasonal that tested positive for COVID. She was off of work. Her dad worked at the Highway Department. He was off of work. These people work, there's no screens in front of them. They basically, they work right next to their coworker, that they're laying asphalt, fixing your roads. And we're just going to forget about them, I guess, because they're not essential workers. And this year, we will probably in labor save about what's like $1.5 million due to basically not replacing workers as fast. I mean, we had 119 people just quit. You know, they basically left the county, and it takes 6 to 8 weeks to replace them. So our workers are picking up that slack. You know, there's nobody there to fill in when the phones have to be answered. Can you hear me?
Yes, we can hear you, Supervisor Bender.
There's nobody there when the phones need to be answered. I looked at that the finance director's report. She filed like $100,100 some thousand worth of claims for Colvick. It's 6 pages. Her office had to do that. It was extra beyond what they normally would do. You know, we're going to be a surplus this year under budget between $8 and $10 million. And our most essential thing that we have is our employees. And if we can't keep our employees working, we're going to become a training facility. And we can say, well, it's $500,000 to $56,000. They saved us somewhere along the line between $8 and $10 million this year. So I think our employees are valuable, and maybe we should pull it and work on it some more. But I truly believe it's necessary to reward the people that have done an excellent job with this COVID. They showed up for work when there's nobody there to do the COVID. The Parks Department employees are telling them they're coming in 2 hours late. They rolled down their window, they got a mask, but they're putting themselves at risk every day. And I think they should be given something for their time and effort. Thanks.
Thank you, Supervisor Bender. Next speaker is Supervisor Schellinger, followed by Supervisor Wingren.
Thank you, Mr. Chairman. So it feels a little bit like the Peanuts cartoon, and we're back to Lucy with a football. And the same people who talk about fairness today are the same people who last month voted against a resolution to the resolutions we had that were similar to this. And a lot of those people are the same people who are unwilling to take this up and try to make this resolution better. I think the point is well taken that this is not the perfect resolution. It doesn't have some of the nuances and ability to really get at the problem. But we also have a P&F committee that wouldn't take this up, and that makes it harder for us to get an ideal resolution. You know, I've heard a lot from people who have questioned who should get raises, public or both a hazard compensation. If it should be public employees, private employees, and I don't necessarily think that this is the appropriate comparison. I think first of all, we are one of the bigger employees in our county. We should be leaders for setting standards for what it means to offer employment in this county. And I don't think that we should be treating our employees as the byproduct of a race to the bottom. There are some incredible employers in our community, big employers that have been in front of us in offering a hazard pay or bonus pay. I think different companies have structured it in different technical ways, but in one way or another, it is additional money being transferred to employees. Aurora, Kroger, Home Depot, Quick Trip, Sutton Transport, Walmart, CVS, Dollar General are just a few of that I know of that offered employees either increases just as a straight cash incentive, such as the one we're considering, and some of them set them up as hourly adjustments to wages. I think we are asking our employees to do things that are above and beyond their job description. To ignore that perhaps shows some of the experience people have beyond their working years on this board. And working at home is no joy. As somebody who has been forced to work at home for the last several months, I can say, it's not a walk in the park. There are a lot of adjustments that I have to do. I'm sure our county employees who are working from home have adjustments that they have to make as well. The adjustments that our employees are making across departments are things that are just frankly not things that we have set out to pay them for. And for that reason, I have put my name on this as a co-sponsor and support it. Although I do have one question that kind of came to me that maybe was an unintended consequence of the way this was written. It was brought to my attention that some people believe that there are employees at the county who are left out of this. I would like some clarification as to whether or not employees in the public safety department would be included either as regular full-time employees or regular part-time employees.
Is our Human Resources Director, Mike Collard, available for that answer? If not, then would our Finance Director, Vicki Fitzgerald, be able to answer? Oh,
Mr. Chairman, I'm here.
Please go ahead, Director Collard.
Yes, with respect to the Sheriff's Office, most of the employees in the Sheriff's Office are members of the Deputies Union. The employees who are not members of the Deputies Union would certainly be included in the bonuses authorized by this resolution. With respect to the members of the Deputies Union, we would have to negotiate that with the Deputies Union before making the payments. I can't negotiate it until the board authorizes it. Currently, we are under contract with the deputies till the end of the year, so we are negotiating a new replacement contract. But this would be an interim negotiation that we would have to do with the union during the term of the current contract. It wouldn't reopen the other terms of the contract. So if the board approves the resolution, it would be my plan to go to the union representatives, say this has happened, say I know we have to negotiate it, but it'll be a one-sided negotiation. I'm just offering to pay you some more money. I can't speak for the union, but I think we can guess what their answer would be. So I don't foresee any particular problems, but I can't guarantee. The union may want some other conditions or some other limitation or some other structuring, which of course I couldn't do because I could only follow the terms of the resolution approved by the board if it is approved.
Thank you, Director Collard. Anything further, Supervisor Schellinger?
Nope, thank you very much.
Thank you. Next speaker is Supervisor Wingren, followed by Supervisor Zelmer. Please go ahead, Supervisor Wingren.
Mr. Chairman, I have great respect for the people that spoke on behalf of county employees. That's not the question. We all value and appreciate the great work they do for all of us. They are just wonderful people. I see their work in many places every day. Last month, we authorized additional pay for the Parkview workers who work directly with COVID patients. In addition, the money to pay those bonuses was part of a money contribution given to Parkview for that purpose. It was not taken from the tax revenue. I get bothered sometimes when I talk to people as I go out throughout the district about OPM. They accuse us of speaking and spending other people's money, OPM. We're really good at that. But this money is money that we took from them by taxing too much. And now we're saying, we don't care if you're unemployed. We don't care if you're out of work. We don't care if your kids are not able to go to school. You know, this is not, again, about taxpayer subsidies for county employees. It's about taxpayer subsidies in general. This is not the right place to spend OPM. By the way, I'd like to call the question.
Thank you, Supervisor Wingren. So the motion is to call the question, to call previous question. Is there a second?
Second.
There's a motion and a second, and just so everyone is aware, unlike postponement, this is not debatable, which means we go directly to a vote to call the question, which would effectively end debate on this issue and go directly to a vote on the actual resolution. So just as a reminder, this also requires a 2/3 majority to call the question. Okay, so I think we are going to have to do a roll call vote to call the question on this. So I'm going to ask the clerk to call the roll, say yes if you agree to call the question, which basically means we end debate. We go right to a vote on the actual resolution. If you don't want to end debate, well, then you say no.
Supervisor Konetsky,
No.
Supervisor Brunn,
Yes.
Supervisor Borchert,
Yes.
Supervisor Eisen, Supervisor Eisen, okay. Yeah, Supervisor Ramos?
Yes,
Yes, okay,
yes.
all right, thank you. Supervisor Ramos? Supervisor Defferding?
Yes.
Supervisor Lenz?
Yes.
Supervisor Newhoff? Supervisor Newhoff? Supervisor Nussbaum?
Yes.
Supervisor Spellman?
Yes.
Supervisor Albrecht? Supervisor Gabbard?
Yes.
Supervisor Bender?
No.
Supervisor Conrad?
Yes.
Supervisor Shorsey?
Yes.
Supervisor Belmonte?
Yes.
Supervisor Gordon?
Yeah.
Supervisor Wingren? Supervisor Lautenschlager?
Yes.
Supervisor Norton?
No.
Supervisor Markey? Supervisor Zelmer?
Yes.
Supervisor Stellinger?
Yes.
Supervisor Buck?
Yes.
Supervisor Powers?
Yes.
Supervisor Locke? Supervisor Cox? Supervisor Finch? Supervisor Youngquist? Supervisor Fari?
Yes.
Supervisor Rasmussen?
Yes.
Supervisor Keller?
Yes.
Supervisor Egan?
Yes.
Supervisor Ellis? Supervisor Snyder?
Yes.
Supervisor Jones?
Yes.
Twenty-four to 3. Twenty-four to 3.
So that vote was 24 to 3. So that carries. That needed a 2/3 majority for passage. So we are now then on officially the actual vote on resolution number 097-10-2020. Allow additional hazard pay in the form of one-time bonuses to Winnebago County regular employees be funded from the undesignated general fund balance. We will also do a roll call vote on this as well. So you're gonna say aye when the county clerk calls on you. Vote no if you are opposed to it.
Supervisor Konetsky?
No.
Supervisor Brunn?
No.
Supervisor Borchert?
No.
Supervisor Eisen?
No.
Chairman Ramos? Supervisor Defferding?
No.
Supervisor Lenz?
No.
Supervisor Newhoff? Supervisor Nussbaum?
No.
Supervisor Spellman?
Aye.
Supervisor Albrecht? Supervisor Gabbard? Supervisor Bender?
Yes.
Supervisor Conrad?
No.
Supervisor Shorsey?
No.
Supervisor Belmonte?
No.
Supervisor Gordon?
Aye.
Supervisor Wingren?
No.
Supervisor Lautenschlager?
No.
Supervisor Norton?
Aye.
Supervisor Warnke? Supervisor Selmer?
No.
Supervisor Schellinger?
Aye.
Supervisor Buck?
Aye.
Supervisor Powers,
Aye.
Supervisor Locke, Supervisor Cox,
Aye.
Supervisor Finch. Oh, he was abstained, sorry. Okay. Supervisor Yelquist? No. Supervisor Fari?
No.
Supervisor Rasmussen?
No.
Supervisor Keller?
No.
Supervisor Egan?
No.
Supervisor Ellis? Supervisor Snyder?
No.
Supervisor Jost?
No.
Two, 22, 2, 4, 6, 8, 8 to 22 with an abstention.
So the vote on that was 8 yes vote, 22 no vote, and 1 abstention. So that motion fails. That actually concludes our business for this evening. So first, before we do a motion to adjourn, I just want to thank all the public who's still on the line for being with us for 5 hours. I certainly want to thank the county board as well for their attention and deliberation this evening, and all the staff who also made themselves available this evening. And with that, I would call on Supervisor Albrecht for a motion to adjourn to October 26th. Supervisor Albrecht?
See you awake?
Will you please do it again, Supervisor Albrecht?
Move to adjourn till October 26th.
There's a motion to adjourn to October 26th. I did hear a second. All those in favor say aye.
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 Opposed, say nay. We are adjourned, everyone. Thank you very much. Have a safe evening. Thank you all.